in last year, March. And up to now, they haven't done the deductions. Do you have a copy of the letter I wrote to the controller?
Yes, please.
Auditor, have you started that letter?
Not yet, Honorable Chair.
Yes, the Auditor General was copied in that letter.
Get a copy of that letter to the auditors. And they will monitor how the recovery is done. But it doesn't show seriousness with the hospital. Paragraph 216, Honorable Sampson.
Thank you, Mr. Chair. Our issue here has to do with unearned salary. Two separated staff, an amount of 19,649. You were asked to recover the money. Have you recovered the amount?
Please be quick and respond to the issue. Have you recovered the money?
Please, partially.
Partially means what? How much have you recovered?
Use the mic.
Okay. Sheila Lawe has been referred to NIB and CID per letter dated November 2022. And also, Kani was contacted and had paid an amount of 5,436 Ghana cedi as at February 2023.
Brother, that is just, and it's in the report already. I'm talking of the 19,646. I'm not talking of the total amount per over 24,000. That one is captured by the auditors. Yes. The 19,000. Now, Kani owes 7,900. Sheila 11,000. How much of this amount has been recovered is what I'm interested in.
Controller. Yes, please. The Controller and Accountant General has done the deduction for the remaining amount.
I thought this time you wouldn't have gone there because before I asked the question, it came to my mind. So where are we now? Effort are you making as a director of the hospital? Because you will be asked to recover the money. So what efforts are you doing now?
Mr. Chairman, it looks like those people from Accra Psychiatric Hospital don't know what they are talking about. No, this is really serious. You are sitting in front of us, we are asking you questions. You can't give us anything. Do you have anybody competent enough at Accra Psychiatric Hospital who can give us the right answers? You have anybody out there?
Yes, please.
Sorry, when I say I, repeat after me, right. You add your name. Okay. I, your name.
Dr. Kojo Manfoobeng.
Swear by the Almighty God.
Swear by the Almighty God.
That the evidence I shall give before this committee.
That the evidence I shall give before this committee.
Touching the matter in issue.
Touching the matter in issue.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help me God.
So help me God.
Thank you very much. You may receive a seat.
Kindly introduce yourself.
I'm Dr. Kojo Manfoobeng, Hospital Director of Accra Psychiatric Hospital.
Okay, you're welcome.
Thank you.
So come and bail your people.
Please.
Now,
Donata,
you can ask the question now.
Donata.
Yes, sir.
there's this issue of two of your staff
Yes.
separated, and they owe 19,649. According to the auditors, you are supposed to recover the amount. The simple question is that, have you recovered the amount and interest? Because that's the recommendation.
Yes, sir. Part of the amount has been recovered. And there are two staff, if I may speak about them separately. For Sheila Lawe, the issue has been reported to the NIB and the CID, and they have forwarded the matter to Yoko. So we're currently working with Yoko to see whether we can get the funds retrieved for government. For the issue of Mr. Kani, he has paid 5,436 out of the total amount. Now, what happened was, with Mr. Kani, one of the payments for which he's being charged was after he had separated, but it was arrears from the previous years that he had earned properly. So the remaining amount, apart from the 5,400 that we have received, was actually properly earned arrears. So we are planning to show this evidence of the payslip to the auditors so that we can get the issue resolved.
After the audit, so many months, you've not been able to reconcile Kani's case. Where is Sheila?
She's out of the country. We believe she's in the UK.
Sheila is not Mr.
But Yoko is making efforts to get in touch with her and make sure that we get the money back.
You knew you were coming to respond to this question.
Yes, sir.
Right? So when was the last time you got an update from Yoko? If you say they are making effort, what does that mean?
Unfortunately, we never get anything in writing from them.
So when was the last time you visited them? So that you're able to respond to this question intelligently.
Sir, I have to confess, it was last year.
Last year?
It was last year.
January or February or
it was
December?
around November. I don't have the exact date.
And what is the update from Yoko?
There's nothing specific for. Sorry, I have to find the right words to say.
So when you say they are making effort to resolve this thing, it is not true.
Okay, then I suppose what I meant to say was that we have reported the matter to Yoko.
And you talk about some 5,436. That is already been taken into account by the auditors.
Right.
So if you are explaining the balance of 7,920, you don't have to refer to that one again.
Okay.
Nothing has happened to this.
So for the 7,000, that's the one that upon review, we realized that it was actually all in arrears from, I think, 2018 or 2019 to 2021.
But it's still old. It's old. Whether it's in arrears or what?
No, after he separated, the government paid arrears from those years that he was working.
Okay.
So he had earned those arrears.
So you are saying this amount shouldn't be there?
That's what I'm saying.
Have you agreed that with the auditors?
No, not at this time.
Okay, so you have to do that with the auditors for them to agree.
Yes, sir.
Okay, Chairman.
All right, so auditors, do the reconciliation to find out if the 7,000 for Kani is actually earned. Now, for the Sheila one, you have referred the issue to the Yoko.
Yeah, we referred it to CID and NIB, and they forwarded it to Yoko, so we followed up at Yoko.
So, is there any communication between your office and CID?
Currently, it's with Yoko, but
no. Do you have any communication?
Okay, we have the letters that we
written communication.
Yes, we have
furnish the auditors to confirm that truly the case is before them.
Okay, we'll do that. We have that here.
Okay. Paragraph 219, unserved bond, 52,262. So you've granted one Priscilla Ako for a 2-year study leave with pay to pursue BSc in mental health nursing at University of Cape Coast. So immediately she returned, she resigned. And then the total amount is the office spent on her is 65,661. But she refunded 13,400, leaving a balance of 52,661.80. Has she refunded the balance?
So we've been able to recover an extra 19,647. So not the entire amount, but she's still making payments. And the figure of 65,000 includes tax. So we believe that minus tax, the actual figure should be 56,084 cedis and 89 pesos.
All right, so you need to do reconciliation again with auditors.
Yes.
To take the tax component.
Yes.
Then also take out
What has
the amount she has already refunded. But you said she's still paying.
Yes.
Okay. Provide those information to the auditors so that you can be cleared.
Thank you.
The next one is paragraph 222. Outstanding salary advance. A salary advance was granted to one Dr. Amma Bwedu, 14,400. And then an amount of 4,600 has been recovered from her, leaving a balance of 9,800. Have you recovered this balance from her?
Yes, sir.
Auditors, can you confirm?
Honorable Chair, confirmed.
All right. So let's move to the next one, paragraph 225. High purchase of vehicles. So you bought vehicles on high purchase. And the amount is 77,060 Ghana.59. And the vehicle is what? One VW Trendline Amarok pickup. It's an SUV. And one VW Terramount SUV. Now, the auditors have recommended that the director should do a follow-up to the Director General Ghana Health Service for the delivery of the vehicles. Has the Director General of Ghana Health Service delivered the vehicles?
The program by which the vehicles were being procured got terminated. So what we've done is gotten a refund of the money.
With interest?
Sir, no, sir.
The money was paid to
Ghana Health Service.
Ghana Health Service.
Yes.
Ghana Health Service. Did you keep the money in the account or you put it into an interest-bearing account?
We kept the money in an account.
Not interest-bearing account?
Not interest-bearing, but in a bank account.
Yeah, bank account, if you're not bearing interest, you're just making money for the bank.
The banks have thresholds beyond which they give interest. And with this particular scheme, when we started, because a lot of facilities were not showing interest, so the monies in the account was very small. And so it
was a bad policy?
No, it was a very good policy.
Have you been able to procure any vehicle at all for any of the institutions?
Yes, we procured 49 vehicles. In fact, initially, most of the facilities were reluctant because they wanted to wait and see. So the 49 facilities applied, and we procured those vehicles. But after that, the next set of vehicles, the supplier couldn't deliver because obviously a lot of things had changed on the macroeconomic front.
Anyway, even the dollar is very high now, so. Auditors, can you confirm that the money has been returned to the psychiatric hospital?
Honorable Chair, the entire amount has been refunded.
Paragraph 228, Honorable Akwesi.
Thank you very much, Chairman. Mr. Chairman, this has to do with some uncompetitive procurement. So the tune of 51,760 Ghana cedis, 68 pesos. However, the auditors recommended that the head of finance and the hospital director should comply with the procurement laws. Are you doing that currently?
Yes, sir, we are.
Auditors, that is your recommendation, and are they following your recommendation?
Honorable Chair, we are yet to have evidence to that effect. This is 2022, so with the 2023 audit, I'm sure we'll be able to tell whether they are following the procurement regulations or not.
Sure, I hope if they do, you put it in. If they don't, you don't recommend this again. That you say that appropriate sanctions must apply. All right, Mr. Chairman, that'll be all.
I would like to advise the Auditor General that now that this committee has worked to clear all the arrears, you must put in place a measure for a follow-up. Because as soon as the 2023 report is issued in June, end of June, July, we will start work on it. So we don't have any arrears again. So we don't have space now. So kindly communicate to your bosses to make an arrangement to do follow-up. Don't wait until the subsequent audit before you do a follow-up.
Well noted, Honorable Chair.
All right, that'll be all for the Accra Psychiatric Hospital. Let's do Princess Mary Louise Children's Hospital. Are they here? Princess Louise, or Ghana Health Service, you take care of it?
Yes, sir.
Okay, good. Paragraph 230, Honorable Isaac.
Thank you, Chairman. Chairman, again, it's about uncompetitive procurement. You procured various goods and services to the tune of 96,470.31 Ghana cedis without go through the proper procurement process. There was no competitive bidding. And the recommendation is that the medical superintendent should strictly comply with the public procurement laws. Are you doing that subsequently?
Thank you, Honorable. The finance follow-up showed that they had the other alternative invoices were not attached to the payment invoice, but they have since retrieved them, and they've also showed that will subsequently ensure that they are compliant and they are filed appropriately.
Auditors, is that the case?
Honorable Chair, at the time of the audit, these alternative quotations were not presented to us. And when you check our recommendation, we are asking that in the subsequent procurements, they are supposed to follow the law. So in our audit, we will confirm that.
So you are unable to confirm what he's saying, that they've now been able to trace the other quotations?
Honorable Chair, we don't have those quotations.
Yes. Please, do you have the other quotations with you? Have you shown them to the auditors?
Honorable Chair, yeah, and we've shown them to the district auditors.
question was, when did you show to the district auditors?
I didn't get that. That was I think somewhere October last year.
22.
October 2023, sometime October 2023.
And the auditors are not aware. Anyway, if you could do that from here. And also, what about the actual recommendation, whether subsequently you are following the procurement?
Honorable Chair, we are following the procurement rules, as recommended.
Chairman.
Auditors, any indication as to whether they now comply with the law? Or you haven't done a follow-up yet?
Yes, Honorable Chair.
All right, so let's move to National Nurses Training College, Pantan. NTC, Pantan. Are they here? If you are here, kindly come forward, please. Who's Ernest? Kindly introduce yourself. Sit down and introduce yourself to the committee. Have you been sworn in? Have you been sworn in? Were you here when they took the oath? Okay, Clark.
Yes. Yes. The scripture to your right hand. Okay. I, Lydia Kanyo Nyame Hafuba,
Swear by the Almighty God
swear by the Almighty God
that the evidence I shall give before this committee
that the evidence I shall give before this committee
touching the matter in issue shall be the truth, the whole truth, and nothing but the truth. So help me God.
So help me God.
Okay, you can now introduce yourselves. Use the mic. Put it on.
Thank you, Honorable. I am Lydia Kanyo Hiame Hafuba, Nurses Training College, Pantai.
What's your position?
Principal.
Please, I am Stella Sigoka, internal auditor.
All right, so you have one issue, paragraph 232. It's on uncompetitive procurement. It looks like most of the health institutions, you procure on your own without recourse to the law. So we are having all these uncompetitive procurement. So you procure from 14 payments, totaling 51,874.58 for various procurement between 2021 January and December, without at least 3 different quotations. You've been asked to ensure that anytime you want to purchase, you follow the procurement law. Let me find out from you, do you now procure in accordance with the law?
Thank you, Honorable. Please, compliance and adherence now in full force, and we are going by it.
So you're sure that you'll not be cited for uncompetitive procurement again?
Yes, Honorable.
All right. I will not ask the auditor if they have any evidence because they haven't done the follow-up yet. So I'll take your words. We have recorded you, that you are not doing the right thing. You'll not be started again. So on that note,
Yes, Honorable.
on that note, you are discharged. You can go.
Thank you, Honorable.
Nurses and Midwifery Training College, Pantai. Have you also taken the oath? So kindly introduce yourself.
Thank you. My name is Elizabeth Na Adua Mensah. I'm the principal of the school.
Thank you very much, Mr. Chair. My name is Abdul Fattah Oshani, Head of Finance.
Thank you very much. You're welcome. So you also have one infraction. It's about student debtors. So about 283 students owe the school a total amount of 79,273 Ghana cedis. You are asked to recover the money from the student. Have you done that?
Please, partially.
Okay, give us the detail. How much have you recovered? What is outstanding balance?
Out of 78,723, we've recovered 26,926 and 50 pesos. The outstanding is 48,251.50 pesos.
How are you going to recover that? Tell the committee.
We've sorted out those who are owing, and we are calling them and their parents to come and pay.
And are they coming?
Some have responded.
Apart from calling them, do you have any other measure by which you think you can get them? Maybe coming for their certificate or results or whatever.
Some that we are not getting, we are contacting their mates for their contacts to do that.
And I know you are calling them. I'm saying that apart from that, do you have any other criteria or measure by which you can get them? Where they can walk to the school themselves, and then when they come, you can then use the opportunity to demand the money from them.
Yes, Chairman, for those who are owing, we are withholding their results. So that was the first line.
So all those people who are owing, they haven't come for their results?
No, please.
Okay. Now, my last question. What measures have you put in place to ensure that students don't owe? By the time they leave the school, they will have cleared all their arrears.
Yeah, we've been given permission from the ministry to ensure that students on reopening pay 60% of their fees, and then the remaining 40% before the end of the semester. And we are strictly going by that. Also, we ensure that by the time they are writing the exam, no one is owing. We hold brief for those owing less than 200 cedis. And then when their licensing exams results also come in, we block the results until they pay. And last year has been very fruitful.
All right, auditors, can you confirm the balance outstanding?
Honorable Chair, the total recovery is 26,926.50, leaving a balance of 52,346.50.
But I've seen some discontinued students. What is the discontinued student that you?
They
you
stopped the
reported to
school.
us.
They stopped the school without permission.
All right, so they owe 3,545.
Yes. Yes.
So, Michael, take that figure from the 52,000 and see if we agree with the 49,000 that she's talking about. The figure is 3,545.
Honorable Chair, it will come to 48,801.50.
Okay. Is that the balance outstanding? The balance outstanding you mentioned is how much?
Please, we have 48,251.50.
All right, okay.
Pesos.
That's fine. So we continue to pursue the students and then see what other measures you can put in place to recover the money. And then don't allow further accumulation of arrears by students. All right, that'll be all for you.
Thank you.
Thank you.
School of Hygiene. School of Hygiene, please come forward. Are we taking the oath? Now, those people who are here to respond to issues, but you haven't taken the oath, kindly come forward. All of you should come forward. If you are here, you know you are coming to respond to issues, but you have not taken the oath yet. Please come forward to take the oath. Please come forward to take the oath.
I
swear by the Almighty God.
Swear by the Almighty God.
That the evidence I shall give before this committee.
That the evidence I shall give before this committee.
Touching the matter in issue.
Touching the matter in issue.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help me God.
So help me God.
Thank you very much.
School of Hygiene, kindly introduce yourself to the committee.
Smile Amechi Kobina. I'm the principal of the school.
My name is Ahime Elisha, the head of finance.
Thank you very much. You have two issues in the report. The first one is paragraph 237, non-payment of rent. This an amount of 40,000 was owed to the school. By 14 employees, 2 separated staff, and 3 non-staff who occupied the school's hostel from February 2019 to December 2021. They owe 19,680, 16,800, and 3,520 respectively. The total amount is 40,000. The auditors observed that the occupant used electricity and water without paying any utility bills. So they are recommending to the principal to recover the 40,000 from the occupants. If you fail to do that, you, the principal, must pay this money. Have we been able to recover the money from these occupants?
Thank you, Honorable. We've been able to recover 10,000. 10,000 cities. Yes.
Only 10,000? Only? How are you going to recover the balance of 30,000?
Well, Honorable, we've given them letters, and now we are making the effort to collect the money from them. By 31st March, they should be able to finish paying this money.
Are they still at post? Are they still with the school?
Yeah, a few of them are with the school, but some of them are on pension. But before I took over, I came in 2021, and some were on pension before I came. So we explained this issue to the auditors. Yeah. At least even getting young people to come and teach in the school is quite difficult. It's unattractive. We explained to the auditors that these people living in the cubicle, this thing should be taken off. But all the same, they didn't listen, and then they took.
They live in a cubicle?
Yes.
That is a hostel?
Yeah, the hostel. A small cubicle. So that young people who had the zeal to come and teach will just have to be there. I mean, that is the little motivation they could get, but the auditors didn't understand.
Now, but they live there permanently, right?
No, but now we move all of them. They are no more there.
They are no more there?
Yes. Yes.
So where are they now?
They've rented.
They've rented their own place?
Yeah, their own place, yes.
But what was the rate that was used to calculate these figures?
40 cities, Honorable.
Per month?
Yes, per month, Honorable. Yes.
I think it's reasonable.
Well,
in Accra,
Honorable, quite reasonable. But attracting young people, you need to motivate them to stay at post to teach young people, to impart knowledge.
But I don't think accommodation is the only thing that you can use to attract young people. Young people, accommodation is not their priority.
Well, we give them other incentives.
Yeah.
So I think that is it. Yes. Yes. All right.
Auditors, can you confirm that 10,020 Ghana cedis was recovered, leaving a balance of 29,980 Ghana cedis?
Honorable Chair, we don't have evidence to that.
School of Hygiene, you haven't given any evidence to the auditors?
Honorable, please, we will forward it to them.
So, you don't wait until you are here before. As soon as you have done that, inform the district auditor.
Yeah. Honorable, we gave the payment receipt to the ministry.
No, the auditors, you must give the auditors as well.
Oh, okay.
The auditors, they will confirm. If you give it to the ministry, they will bring it here. Is the auditor who came to do the audit is the one who should receive any recovery you are making. Uh-huh. So make sure you provide the information to the district auditor.
Okay, thank you, Honorable.
And this one goes to all of us, not only the School of Hygiene. Anytime you are starting the report and any action you are taking on it, if you recover or whatever, kindly inform the district auditor. The district auditor will forward it to their headquarters. So that when you come here, we want a verification, it will be easy to verify. Now, the auditors here are not aware of anything because you did not give the information to the district auditor. All right, let's move to the next one. Paragraph 239. Student debtors. Student owed the school 141,543. Have you recovered the money from the student?
Thank you, Honorable. We've been able to, we liaised with the Ministry of Sanitation, and when the allowance was paid, the deduction was made. So 91,000 was recovered from the students.
Okay. Auditors, can you confirm this?
Honorable Chair, confirmed.
Okay, so how are you going to recover the balance of 50,000?
Yeah. Honorable, please, we are adhering to the policy of the ministry. That is, when school reopen, the student has to pay 60%.
But these arrears, you have to make some effort to recover this one.
Honorable, we are
The
doing
policy is now affecting the new students that are coming or new admissions. So, but these, some of them have even left the school.
Yeah.
Put measures in place to ensure that you recover the money from them.
Yeah. Honorable, please, we when they are coming for their transcript and then the certificates, we collect the money from them.
All right.
Okay.
Okay, that'll be all for School of Hygiene. Let's have Cancer Clinic. GHS, you respond to that. Okay. So, ranking member, paragraph 241.
Thank you, Chairman. Castle Clinic. Here, the infraction is that you made 5 different procurement transactions without going through the procurement procedure. You didn't obtain at least 3 quotations from different sources. And the recommendation is that you should strictly adhere to the procurement process. Are you doing that?
Yes, Honorable, thank you. Yes, we are doing that. I remember 2 years ago we talked about the capacity challenges we have with procurement officers. We developed some SOP and we've done some training. So some of the things we have seen is that last year we had about 25 procurement infractions, but this time it's 9, and we are seeing some progress, and we continue pursuing that policy to ensure that people adhere to the rules and it because they understand them.
Okay, Chairman, that will be all.
Regional medical stores, Accra. GHS, you take care of that. Okay. So, institutional indebtedness. 225 private and government health facilities to which medical stores supply drugs and non-drug consumables owe the medical stores a total of 37,306,037 Ghana cedis, 60 pesos, as at 31st December 2021. The recommendation is that the regional director should, as a matter of urgency, engage the defaulting institutions and use the legal means to recover the debt. Director General, have you been able to recover the debts?
Yeah, thank you very much. We recovered about 32,576,633 cedis with outstanding of 4.7 million now. And we know that because of the time lag between collection and that, they will continue paying, especially now that insurance is paying us more regularly.
Auditors, can you confirm?
Honorable Chair, confirmed.
All right, so just continue to recover the balance. Paragraph 246, ranking.
Here, thank you. Here, Kolebu Teaching Hospital. The infraction is that 5 staff.
Kolebu, is Kolebu here? Kolebu Teaching Hospital. Okay.
Okay.
Kindly introduce yourselves. I'm sure you have taken the oath already. Have you taken the oath?
Yes, please.
Okay, good.
My name is Gauga Gideon, Acting Director of Finance.
Munir Al Hassan, Director of Administration.
Kennedy Gatogo, Accountant.
Okay, you're welcome. The infraction is that 5 staff would you paid an ensign to about 5 staff, amounting to 10,992 cedis, 99 pesos, and you have to recover this amount, failure of which the chief executive will have to pay. Have you recovered the amounts from the staff?
Yeah, Honorable, we've been able to recover the unearned salary in full.
In full?
Yes, please.
Okay. Auditors, can you confirm if they have recovered the amounts?
Honorable Chair, full recovery has been made.
Thank you, Chairman.
Paragraph 248, Vice Chairman.
Thank you very much, Mr. Chairman. Kolebu, we are talking about ground rent defaulters. And they've paid, the total amount is 448,000. And they've paid about 213 out of this, left with 234. What has happened to this amount, outstanding amount?
Honorable Chair, we've been able to recover a total of 139,968.12 out of the outstanding, leaving a balance of 94,405, which stands in the name of FBN Bank.
So FBN Bank is the only one that hasn't paid?
Yes, please.
So do you mean to say that Societe Generale and Standard Chartered Bank have paid?
Yeah, they've all paid their money.
Including the Engineering Staff Welfare Union?
Yes, please.
Auditors, could you confirm that, please?
Honorable Chair, the only amount outstanding is that of the FBN Bank.
So FBN Bank said they were going to pay it yesterday. And as of today, they haven't paid. So we are asking FBN Bank, pay the money. Thank you very much, Mr. Chairman.
Thank you very much. So I think that the balance left at 94 is for the FBN Bank.
Yes, Mr. Chair.
Okay, we are just encouraging them to do so. It won't help them.
We hope so. Thank you.
Thank you. All right, that'll be all for Kolebu Teaching Hospital. Pantine Hospital. Kindly introduce yourself if you have already taken the oath.
Yes, please. My name is Collins Kese, Deputy Director in charge of administration.
My name is Bernard Motoji, Accountant.
My name is Abdul Abubakar, the head of finance.
Thank you very much for coming. We have paragraph 250, ranking member will take it.
Thank you, Chairman. There were 2 procurements totaling 4,200. These procurements were not supported by the relevant documents, and the auditors are recommending that the medical director should recover the amount from the head of finance. Has that been done?
Yeah, Honorable Chairman, I want to say that it wasn't a procurement issue. It was a payment which the attaching PV was detached at the time of the audits, but it has been retrieved and forwarded to the auditors.
Yeah, but I didn't say procurement. Did I say procurement? No, it's unsupported payments. Oh, sorry. Okay. Right. So, Auditor, can you confirm whether You are satisfied with the relevant documents now.
Honorable Chair, the payments have been supported now.
Thank you, Chairman.
Thank you. Paragraph 253, Honorable Roxon.
Chairman, thank you very much. Do you have your medical director here?
No, please. He's currently indisposed.
Okay. The case by the auditors against you is that you offered official accommodation to some 78 members of your staff. They defaulted in the payment of the rent in excess of 104,000 Ghana cedis. And the recommendation is that you should take steps to recover it and also put measures in place so that they don't default. One, have you recovered the rent?
Yes, please.
Have you brought this to the attention of the auditors?
Yes, please.
Two, have you put in steps so that your staff who occupy official accommodation do not default in rent payment?
Yes, please. We have done that. Those who are not complying with payments, we have
you done that?
Yes, we have done that. Please.
So how did you do that?
First, we have submitted the defaulters staff to controller and accountant. They not to be deducted as source. That's the first.
Yeah,
one.
That's the recovery.
Yes,
and but you also directed to ensure that going forward they do not default in rent payment.
Yes,
we are interested in that measure.
Yes, we have signed a new tenancy agreement with them that which is part of the accommodation policy of the hospital. That if you default,
but the tenancy agreement won't compel them not to pay rent.
That's why I want to add that if they default for 3 consecutive months, they will forfeit their accommodation. And it has brought to their notice, and staff are complying now.
You see, the committee is interested in to hear that going forward, rents are paid at the end of the month. If you factor into the tenancy agreement the opportunity for them to default, they'll still default. That is the measure. Yes. So we'll leave this matter. Auditors, as these matters come to your attention, the recovery as well as the measure to avoid rent default.
Honorable Chair, the entire outstanding amount of 104,000 has been recovered. With the measures we are yet to.
Chairman, thank you. That'll be all.
Paragraph 256, Honorable Bauer.
Thank you, Mr. Chairman. Pantine, this has to do with 2 institutions who owe the hospital an amount of 20,354, and the recommendation was that you should take steps to retrieve or recover these monies. Have you been able to recover these monies?
Honorable, I want to state that one of the clients, one of the corporation or the debtors was destitute. It was wrongly classified as a corporate institution. Ejara, it was called Ejara Kaswa, and Ejara, the Kaswa meant that was the place that we picked the client for treatment. And so the accumulated bill was about 17,000 was borne by the hospital. So in the first place, it shouldn't be captured by the auditors. The second aspect was the Savrugu Municipal Assembly. I think they also brought in a client, which we took. We have sent letters requesting for payment. They have not responded yet. We have sent reminders, and we hope that they will comply with requests very soon. Thank you.
Did you bring to the attention of the auditors that the first client was a destitute?
Yes, please.
And yes, because they captured it here as Ghana Central Municipal Assembly. who brought the patient to the hospital?
It was a good Samaritan. Somebody brought him there. Yeah.
Mr. Chairman, that's the narration that the first, it's not actually the assembly, but it's a destitute, a good Samaritan picked at Kaswa and brought to the hospital. And the accumulated bills was 17,000.
What is the policy on these destitute? When they bring them their bills, how are they settled?
Yes. Mr. Chairman, if you look at the mental health at 846, Section 88 makes mental health care free. And so in that respect, and then it's also enjoined citizens also to liaise with the police and bring such people to the mental health facility for treatment. So in our policy, we don't charge for those services, which the government will also support the health facility in taking care of such clients. So the policy is that we treat them free of charge. Thank you.
Is that Section 88 or 84? Section 84.
It's per my knowledge, it's 88.
88.
Yes.
Of Mental Health Act.
Yes.
And what is the act number?
Act.
The act number.
846.
846. Auditors, are you aware of this provision in the act? If we confirm from the act of what he's saying, I think we should write this in off. So temporarily is written off, okay? But we'll confirm.
Chairman, what was the Savlugu one?
Yeah.
Was that also a destitute?
That one we can't confirm, but once the assembly brought the person, it may assume that they might also be the client might be the same state, but we are written to the assembly for payment, which they are yet to comply.
Mr. Chairman, the second issue seems like the first one, just that the patient was brought in by the assembly. So I don't know what decision we're taking on it. I'll leave that to you, Chairman.
Yeah, I want a little clarification on your policy. Did you say that you don't charge for treating people with mental health, or but is there any rich mental health people?
Honorable, that's not my position. What I stated was people who are picked from the street, public space, destitute, that are brought to the facility. Thank you.
So, how would you determine this one was picked from the public space and is destitute?
Normally, they are brought by the police with the assistance of a good Samaritan.
Well, with the Savlu one, can you remind the assembly for the 3,110? You wrote to them, they didn't respond. Follow up with a reminder. And then, if they respond, we'll know the position of that one also. Yes.
Well noted.
Thank you, Chairman. The issue of bringing somebody who had mental challenges from Savlugu all the way to Pantan raises a serious question. What it means is that the entire northern belt has no facility, and that is why this happened. Is that not the case? And Chairman, if that is so, we need to advocate. We need to advocate for some facilities to be established in the northern parts of this country. Yeah, Director, do you have any plans to establish facilities in the northern parts of this country so that assemblies don't have to bring patients all the way from Savlugu to Accra? And that is only one instance. Only God knows how many more people may have been cured if there were facilities in that part of the country. So any plans?
I think that question should go to the ministry. Is there any plan in place to send a mental hospital to the northern part of the country?
Thank you, Honorable. The DG really wants to respond to that. Yes.
Yeah, thank you, Honorable. Mental health is somehow mainstreamed. And so there are beds and there are departments in the hospital that also take care of mental health cases. Whether the teaching hospital, Borga Hospital, Wa Hospital, they have them. But I know that's part of the Agenda 111. Mental health, one is supposed to be built in Tamale. A psychiatry hospital is supposed to be built in Tamale. I don't know, but we have made generally mainstream that both from community level mental health officers and we have some psychiatrists in our regional hospitals taking care of these cases.
Mutala.
Yes. If we want to stretch the argument, then we would say that then we may not need mental health facilities. Let me finish. We may not need mental health facilities in the other areas. We have them existing because already there are hospitals and they can take care of them. There is a rampant use of drugs now, and I guess you are aware. In my constituency, we have several cases of people who are engaged in that, and the only and the only means by which people have is to go through this, if you like, local doctors, and who subject some of these people in a dehumanizing circumstances. I wish the minister was here, because I've heard this story of providing a mental health facility in Tamale through Agenda 111. We've been hearing it for years now. I don't know whether you are in a position to specifically tell this committee what time can we have this thing done, taking into consideration this year is virtually gone. So whether you can speak to it, if you can't, fine. I mean, this year, 2024 is virtually gone. Order. If the argument is that we've just started, there isn't any sign of commencement of the work to have that facility done. And with the little experience I have in construction, even mobilizing to go on site will take about 4 to 5 months. And that is why I say this year is virtually gone. If you can speak specifically to it, if you can't, that is fine. Maybe perhaps the minister would answer this. I'm also when the government is getting out.
Honorable Chair, in the last question, I'm not in a position to answer when, but I think there were some preliminary statements you made. That is, mental health is everywhere in the country. And so they have a gatekeeper system where those that can be managed at those local levels are managed. And that's where Ghana Health Service comes in. When it's more severe, then we refer them to the specialized mental hospitals to take care of them. So that's what we are looking at. But I believe that it's important that there are enough across the country to manage them. Thank you very much.
All right, honorable members, let's move forward. Paragraph 259, Honorable Apak.
Thank you, Chairman. 259, payment of unapproved allowances. But Chairman, this, my report says that Mamobi General Hospital, and then you have my paragraph under that. So I'm not quite sure if Pantang is responsible for the question.
Yeah, so is Mamobi, it's not Pantang.
Yes, very well.
So Virtually, Pantan is only one. Let me see. No, we are done with Pantan, so.
Very well.
Let's go to Mamobi. Ghana Health Service will take it, so you can go ahead.
Thank you, Chairman. The issue at hand has to do with payment of unapproved allowances. According to the auditors, an amount of 286,244 Ghana cedis, 59 pesos, was paid to management and staff of the hospital from IGF for the year 2021 without the approval of the Ministry of Finance. The auditors have recommended that the medical superintendent seeks approval from the Ministry of Finance through the Ministry of Health, failing which they should desist from the payment of such allowances. So, has approval been sought retroactively with regards to this infraction?
Yeah, thank you, Honorable. There are several allowances that fall under this category. Some of them even is part of some of their collective bargaining agreement, and these are that have been approved at the management level. We are compiling all the various categories to be sent to Ministry of Finance through the Ministry of Health for approval.
Chairman, the issue is still not resolved. According to the Director General, the process is ongoing. Auditors, what do you have to say with regards to this response?
So, Chairman, like you said, the issue is still outstanding. We don't have the approval from the Ministry of Finance yet.
So, Director, can you give us a timeline with regards to when you are going to submit the omnibus list to the Ministry of Finance for approval?
Yeah, Honorable, we are working on it. We hope that by end of March we would have submitted to the Ministry of Finance.
Very well, Chairman. I yield to you.
What list are you compiling? What list are you comparing?
There are several categories of allowances.
Yeah. According to the report, there are 7 different types of allowances.
Well, it's countrywide. So for this facility, there are 7. But there are certain situations that also allows for that. So we need to compile all of them.
Are you saying that for each different hospital or facility, there are different allowances that they earn?
Some are common, some of them are very peculiar.
So
that's why we need to compile.
So if you put all in together, how many types of allowances that you want to request the finance?
Oh no, but that's what we are trying to review, and those ones we can cancel. As I mentioned last year, there are some we asked that they cannot, that was not allowed.
No, this thing cannot take a longer time to do. As a Director General, if you send a circular that within a week submit all the allowances you pay in your hospital or your facility, they will all submit. It can take 1 day or less to compile it. So we have 20 or 30 types of allowances that we pay in our facilities. Which ones do we ask for approval? Which one do we drop? It's easy to do. If you're giving yourself, say you are working on it, and you want to give us this answer, and that's the end. No. We want to see concrete action. You can do this within a week or 2.
We'll take your directive.
Yes.
And we'll do that. Thank you.
So in 2 weeks, let's get a feedback. What action you've taken on this?
Thank you, sir.
Now, Achimota Hospital. Paragraph 261, Honorable Mutala.
Thank you, Mr. Chairman. The infraction is unpresented payment vouchers. The auditors have realized that, based on the records that they have, that 4 payment vouchers were used in disbursing a total amount of 5,178 Ghana cedis, 50 pesos, without the available audit. The recommendation of the auditors is that the medical director should recover the total amount of 5,178 from the Director of Finance and pay same into the Auditor General's recovery accounts. Have the monies been recovered?
Honorable Chair, 3 of the payment vouchers amounting to 4,629 Ghana cedis were retrieved and submitted to the auditors, which they verified. And the difference of 550 Ghana cedis was refunded by paying it into the account.
Auditors, can you confirm the assertion?
Honorable Chair, confirmed.
Chairman, I'm done.
Paragraph 26 for Honorable Kofi Adams.
From non-presentation of PVs to unsupported payments. But in this case, the amount involved is 126,577 Ghana cedis, 82 pesos. The medical director was to ensure that this amount is recovered from the head of finance and paid into the Auditor General's recoveries account with Bank of Ghana, failing which the medical director himself was to do the payment. Your update is that you later found the documents and attached them. I remember last year, the chairman said we were not going to be taking late submission of such things. I don't know what will happen in this case, though. What has happened beyond this information you have provided us?
Honorable Chair, most of the supporting documents were activity reports. And as we have provided the updates, they were retrieved and supported and made available to the auditors for verification.
But it's interesting they couldn't find them during the period of audit, and after the initial management, all those issues were highlighted. All these documents were not found, only to be found many months later. For all these that have been listed, starting from February all the way through to December, so the whole year, you are this situation. What kind of financial arrangement do you operate in that particular facility that you have this happening all throughout the year? I'm asking you, not the auditors.
Okay. Yeah, as we indicated, these were activity reports. Usually, when they carry out activities, so it's not like PVs were not available at all.
PVs were available, but the attachments.
Yeah, some of the attachments. So they were mostly activity reports, and sometimes it's difficult getting some of these reports from the focal people who carry out these activities.
So this included LPG gas bought in June 2021 from GOIL at 12,463,000. That one too. They didn't issue you with receipts to attach to the PVs. If you look at the table, item 5.
Honorable Chair, so you realize that something like LPG gas was definitely bought and all that. So sometimes it's when it comes to some of these receipts, definitely if you buy some of these things, definitely like gas, you would definitely get receipts. But sometimes it's communication challenge between the management team who bought it and getting the receipt from that person.
Well, auditors, can you confirm the story? But you yourself, you see the difficulty with which you were telling the story. So let's supervise them well so that these things will not come up again when the auditors get to the field. Because I'm sure you've been put in a very difficult situation to have to explain away this. But auditors, what can you say?
Honorable Chair, they have now supported the amount with the relevant documents.
All right.
So they have now supported.
Okay, thank you very much. Paragraph 267, Honorable Yusuf.
Thank you, Chairman. Chairman, the infraction is that Achimota procured food items to the tune of 68,800 Ghana cedi, but failed to account at the time of audits. What is the status of it as we speak?
Honorable Chair, the SREs have been attached to the voucher and submitted to the auditors for verification.
Auditors, can you confirm?
Honorable Chair, confirm.
Chair, we are good to go.
Thank you. Paragraph 270 is on default in rent payment, 41,807. So according to the auditors, 11 occupants owe rent amounting to this 41,807. The medical superintendent is asked to recover the money from the 11 staff. Has that been done?
Honorable Chair, they've all been recovered.
Auditors, confirmation.
Honorable Chair, the amount has been fully recovered.
Thank you. Paragraph 273, Honorable Chinia.
Thank you, Honorable Chairman. The infraction here is payment of allowances without approval. The auditors noted that 8 different types of allowances totaling 524,553.83 Ghana cedis was paid to management and staff of the hospital from your IGF for the year 2021 with the approval of the Ministry of Finance. The auditors recommended that you should seek to them.
So the amount has been refunded to them?
Yes, please.
Well, the total amount, because in this case, there were 2 amounts the auditors were talking about. The actual amount that they paid plus the other, apart from the 66,000, they paid another 10,000. So we want to find out whether the entire amount has been refunded.
Honorable Chair, they applied for 2 vehicles. One was supplied, one couldn't be supplied. So the 10,000 was an installment payment for that particular month for the vehicle that was supplied.
Auditors, can you confirm for us?
Right. So with regards to the one that was not supplied, the entire amount has been refunded, and then they continue to do the monthly installment for the other one that has been supplied.
But are we saying that we are so hopeful that the second one will be supplied?
Yeah, we are engaging the BWNL to see how we can reinstate that program, because it was quite popular and most of the hospitals are willing to buy so that we can use that. So we are not giving up. The supplier couldn't deliver. We're working through a different process to get it for them.
Okay, Chairman, that will be all for me.
Which company is that? They want to supply the VW. Like, are they those being assembled here in Ghana?
Those assembled here in Ghana.
Okay. All right, so that'll be all for Achimota. Let's go to Adabraka Polyclinic, paragraph 278. Ranking member will take it.
Paragraph 2 and 4 of the bond conditions of Ghana Health Service requires that an awardee shall report to work at the end of the bond period. An awardee who does not report back to his or her previous station within 10 working days after the expiration of the study leave period will be deemed to have vacated the post and shall be made to refund all salaries paid to him or her whilst in school, plus interest at the prevailing lending rate of Bank of Ghana. You granted study leave to one Anita Adwa Bensel for 2 years, and the amount he didn't return to post, the amount involved is 70,933 cedis and 4 pesos. And the recommendation is that if you don't recover this amount from Anita Adwa Bensel, then the principal medical officer should refund that amount. What is the situation?
Thank you, Chair. We've not been able to recover that yet. I think the lady we found out is in the United States. We've also made a report to the Interpol to see how we can assist us to get the money back. And since 2021 till now, I think with the advent of the brain drain, I'm sure, Chair, you will see that we have a series of such happen. But we are working very hard to see how we can find those who guarantors and see how we can retrieve the money.
What do you think of the recommendation of the auditor that if you fail to recover the amount from Anita, it should be recovered from the principal medical officer? What's your view on that?
I disagree, because the approval was given through the region, from the headquarters. I mean, they only made a recommendation, so I think we will have to deal with it as a service, not an individual.
Well, Chairman, I yield to you.
If you agree, you disagree with that, how do we retrieve the money?
We're working with the team at the region, where the guarantors are, to see how we can, together, both headquarters, region, and the facility, find how we can trace either guarantors or trace the woman to be able to get it. That's why we also report to the Interpol if we can identify and see how we get the money.
DG, this is not the first time we are facing a thing of this nature. Have we ever been successful in retrieving these people who have traveled outside?
Yes, we've had, especially after today, and they hear their name on TV. A lot of them come and pay.
Okay. All right, so you need to just double up, and then the Interpol should be able to. When they go, after we have trained them, and they go, they forget. That is why this committee in the past recommended that guarantors alone, or the guarantor system, is actually not effective. We recommended a bank guarantee, that before you are granted this, you should go for a bank guarantee. A bank should guarantee for you that you will come back. And before the bank will give you this guarantee, they will be sure that you will come back. And for the human being, they'll be there, but you can't take that person if there's a default. But the bank will refund the money to the institution if they fail to come. So the bank will make sure they put a lot of things in place. But it looks like that is something that will be difficult for them to get. Just a way of putting something as a standing block that before you get it, you might be sure that you are coming back. You see, it's a challenging thing, actually. Very difficult. Yes.
Chairman, actually, let me, by way of information, you gave this directive last year. Yes. When this matter cropped up in the 2021 report and were interrogated in 2023. You directed as the head of the committee that going forward, this is how this matter, the bond issue, should be handled. So I think it's a directive of the committee that should be carried to the institutions. That this is what Parliament is directing, that they should use banks instead of individuals. Yes.
So I'll jump it.
Honorable, can I?
Yes.
I think that will be difficult because we also need certain capacities. It is also in our interest to train some people to come and offer some service. So putting such major obstacle may be a problem because majority, more than 95+% return. And so we may have to relook at that bank guarantee directive. Thank you.
Thank you. That is why we have to hold you, the head, responsible. If you think you disagree with that, and you also disagree with the proposal for a bank guarantee, then you should be held responsible because you are standing for them that they will come back. Or you are happy that government spend money on them and they don't come back.
No, Chair, I'm not disagreeing with your comment. I'm just talking about the challenges that may pose because we also have certain competencies and specialties and certain that we need to move the service forward. The issue is that if that is going to also deter people from taking up such responsibilities, we also get affected. That's the concern I'm raising.
The next one is actually not for Adabrakap Polyclinic, so we have to go to Adan East District Hospital. Paragraph 283, Honorable Sophia.
Thank you, Chairman. Paragraph 283, unaccounted revenue, which is amounted to 147,134. It is noted that one Mr. Eric Gauga, the former head of finance of Adan East District Hospital, used 21 general counterfeit receipt books to collect fees and charges totaling 157,134.46, but failed to account for the revenue collected. The auditors recommend that the medical superintendent should recover the amount of money from Mr. Eric Gauga. Has Mr. Eric Gauga paid the money back?
Honorable Chair, Eric Gauga has paid the monies. Actually, some of it was not really revenue not accounted for. Through reconciliation, 112,591 Ghana cedis was reconciled as accounted for. The difference of 34,839 he paid.
Auditors, please, can you confirm if Mr. Gauga has paid the money and with the explanation given by them as correct?
Honorable Chair, confirmed.
That'll be all for them, Chairman.
So, is Mr. Gauga still working for the ministry or the service?
Honorable Chair, he's still working for the ministry, but he was reassigned to go and work under supervision instead of being a head of finance.
Okay, thanks.
Paragraph 286, Honorable Quista.
Thank you, Chairman. This is staff advances. The auditors disclosed that salary advances totaling 12,210 was granted to 13 former staff of the hospital. Yeah, and the recommendation was for the medical superintendent to recover the amount. Has it been done? Yeah.
Honorable, thank you. The full amount has been recovered.
So can you confirm for me, auditors?
Honorable Chair, the total amount has been recovered.
Thank you. Thank you, Chairman.
Thank you very much. Shah Osudoku District Health Directorate. Paragraph 289. Ranking.
Thank you, Chairman. An amount of 23,890 cedis was spent, but the auditors were not given the payment vouchers covering them. And the recommendation is that the district director should recover the amount from the accountant. Has this been done?
Which the payment vouchers were retrieved and submitted to the auditors.
Auditor, can you confirm?
Honorable Chair, confirmed.
Thank you, Chairman.
Thank you. Paragraph 292, Honorable Akwesi Konedu.
Thank you very much, Mr. Chairman. Mr. Chairman, this infraction has to do with a high purchase scheme for a vehicle that wasn't delivered, and that Shah Osudoku District paid an amount of 157,448 Ghana cedis. That is about 26% of the purchase price of the car, into an account with the Ghana Health Services. But however, this vehicle hadn't been delivered to them under the contract agreement. And the auditors recommend that they liaise with the medical director and the director of the Ghana Health Services to have delivery of the vehicle, failing which the amount of money be recovered and refunded to them. Director, has that been done?
We've refunded the money to the facility.
The entirety of it?
Yes, please, the entirety.
Evidence of that shown to the auditors?
Yes, we've done that.
Auditors, can you please confirm whether this amount of money has been refunded to Shah Osudoku District Hospital?
Honorable Chair, the entire amount has been refunded. Thank you.
Okay, Mr. Chairman, that will be all for my part.
So the total cost of the VW Terramont vehicle is 604,000 Ghana cedis. At the time, it looks so huge. This is a locally assembled vehicle. And it's so expensive like it. Can we afford it? So we can't ban the home use cars. If one vehicle locally assembled can cost over 600,000 Ghana cedis, how many people can afford it?
It's whether it's a car, it's a truck, or it's
a VW Terramont. It's like it's smaller than Tundra. It's a pickup. Do you understand?
Yeah. So, Chairman, it's about $46,000. It's within the range. What do you mean by local manufacturing?
I don't know which
the raw materials
calculation has been done.
No, I'm reading the report. In the report, it says that we noted that Shah Osudoku District Hospital pay a total amount of 157,448.95 into the Ghana Health Service high purchase collection account, representing 26.06% of the total cost of 604,117.20 for one VW Terramont vehicle. So that's what I'm reading. Is it a report?
I can't confirm the amount.
Okay.
I think we need to confirm because
But it's in the report,
the price doesn't go around that. So I will see whether they paid additional.
All right, let's move forward. Botiano Polyclinic, paragraph 295, Honorable Isaac Opoku.
Thank you, Chairman. Chairman Botiano, they granted an amount of 15,594 Ghana cedis as salary advance to one Marvelous Sami Ban in 2020. And as at October 2021, he had only paid 4,000, leaving a balance of 11,594. So the recommendation is that the remaining balance plus interest should be recovered. What is the update on the recovery?
Yeah, thank you, Honorable. The full amount has been recovered.
So, since probably they are not buying,
Honorable Chair, the full amount has been recovered.
there'll be interest and other things.
Chairman. Yeah, thank you very much. The next one, paragraph 298, on served bond term. This one involved one Miss Evelyn Ajay, who the polyclinic spent 132,152 Ghana cedis for pursuers. She didn't serve the bond.
He absconded.
So the recommendation is that the medical director should recover the unserved bond value of 132,152.04 from her. We want to find out if the recovery has been made.
Yes, Honorable, the full amount has been retrieved.
Auditors, can you confirm?
No, 25. Where is it? Where is it? Okay, sorry. Sorry, let me just correct. I think I'm ringing from the wrong place. You have a balance of 107,000 left. Made a payment of 25,000.
107,000.
Outstanding.
Outstanding. Auditors, can you confirm this?
Honorable Chair, confirmed.
So how are you retrieving the outstanding amount? Is she still paying, refunding the money?
Yes, we are working with Interpol, as in the previous one, to see how we can retrieve.
It means that she's not even in the country.
No, not in the country, in the United Kingdom, in the UK. So we managed to get them to pay 25. We use the same method to retrieve the rest of the money.
Director General, you see, you will spend money on them and they will go. And you don't want us to use any stringent measure to prevent that. Because you need the services.
Yeah, I agree with you. It's just that it's the balance. And if I can have an opportunity to explain the VW with your approval, I think they are supposed to pay over 60 months. It's a high purchase. So once you calculate the interest, that goes.
Oh, you are still going back to the VW?
Yes, I was just trying to clarify that because
we have passed
maybe misinterpreted.
Misinterpreted?
Yeah, because you are paying the money over 60 months. And it's an
5
annual
years.
interest. It's a... So...
Yo. All right, we're here. I'm sure only institutions, company can afford, not individuals like us. As a member of parliament, my term of office is 4 years. So system man is what, 5 years? Anyway, Tama West Municipal Health Directorate, paragraph 302. Unutilized Member of Parliament Health Fund, 184,410. So the auditors noted that the total amount was 184,410, being the MP's share of the National Health Insurance Fund, had not been utilized for many developmental projects. The money had been in the MP's account since May 2020. The details was provided. So the auditors have recommended that the municipal director, in collaboration with the member of parliament, should ensure that the money is used in the intended purpose. Okay, just to avoid the fall in value. So, what is the response?
Honorable, thank you very much. The money has been utilized now. They've actually built 2 CHIPS compounds, one in Sakumono and one in Community 2. So the money has been, and the vouchers has been shared with
auditors.
Honorable Chair, we can confirm that.
Okay. 184 building, 2 CHIPS compounds. I'm sure you said chamber and hall and.
Maybe it's just a support.
Tama General Hospital, paragraph 305. On earned salary, 2,665. Has it been recovered?
Yeah, it's fully recovered.
Auditors.
Honorable Chair, fully recovered.
Okay. Now, Esunafo North Municipal Health Directorate, paragraph 307. Wrongful payment to a contractor, 96,421. So, as captured in the heading, this amount was wrongfully paid to a contractor by name Michels Massim Construction Works Limited. The check by the auditors from the purported contract document reveal a contractual agreement between the Esunafo North Municipal Assembly and the contractor to build a VIP ward for Gosu Municipal Health Directorate, Municipal Hospital, but not the Esunafo North Municipal Health Directorate. So the auditors have recommended the recovery of the amount with interest from the Municipal Health Director, Dr. Eric Akolache, and the accountant, Mr. Bompom, and the same paid into the Auditor General Recovery Account. What is the status of this infraction?
Thank you, Honorable. This was at the inception of the creation of the new region. So even though the money was with the Assembly, the contract was with the facility, the contract was awarded by the Assembly because they do not go well beyond their threshold. So once they finished, the payment was made. But because the contract auditors did not see a contract in the facility, that's what created that. But we have since explained to them.
Auditors, can you confirm?
Honorable Chair, we can confirm that the work actually has been executed. We have inspected the building also.
Okay. Bechem Government Hospital, paragraph 311, vacation of posts. So one, Mr. Anoche Kingsley Kojo, vacated post in May 2022, but was paid salary for that month. The amount is 3,644 Ghana cedis. The medical director is supposed to recover the money from Mr. Anoche. Has that been done?
Chair, Mr. Anoche has paid back the money.
Auditors, can you confirm?
Honorable Chair, the amount has been paid.
Paragraph 314. Another unserved bond. So, DG, you can see that the unserved bonds are increasing, the number. See, here, the person involved is Mr. Gideon Joseph Opoku, who was granted 3 years study leave with pay. But he absconded from the school in June 2022. He was paid a total salary of 60,614.27, covering the period January 2021 to July 2022. The auditors are recommending for the medical superintendent to recover the money from Mr. Godin Gideon Joseph Opoku, has a recovery been made?
Honorable, we've been able to get in touch with the family, and we have an arrangement with the family to pay. I think they are paying 1,050 every month until the full amount is recovered.
How much has been recovered so far?
You've so far paid 10,000.
Auditors, can you confirm?
Honorable Chair, confirm.
All right, so DG, kindly, the medical soup should continue with the arrangement for the recovery of the money. Bechem Municipal Health Directorate, paragraph 317, ranking.
Thank you, Chairman. Here, the procurement limit for the medical director is 30,000 for goods and services and 45,000 for works. The review showed that the medical director awarded contract for PPEs amounting to 51,620 cedis and over and above his threshold. And then in one other instance, he splitted the award of contract for re-roofing of one of the facilities. So the total amount is 53,443 cedis. But he split it into two, 29,280 and then 24,150. And the recommendation is that you should strictly adhere to the procurement provisions. I hope he is doing that now.
Honorable Chair, we are doing that now.
Auditor, can you confirm?
Honorable Chair will confirm that in the 2023 audit.
Okay, Chairman, that will be all.
Ejura Municipal Health Directorate, paragraph 320, Vice Chairman.
Thank you very much, Mr. Chairman. Now, Director General, another unserved bond, and this is 38,883. And at the Ejura Sechodumasi Municipal Health Directorate, Miss Osei Jenfua Constance failed to report back to work after 2 years steady leave with pay. That expired in September 2021. Is she in UK also?
Sir, yes, Honorable.
But we've been exporting nurses to that place anyway, right? Now, Miss Jenfua has guarantors, and one of is Miss Lakia Ibrahim and Mr. Amwaku George. Has this amount been recovered?
Honorable, thank you. 15,000 of the amount has been recovered, and we pay into the Controller General's recovery account.
But what about the rest?
We have an arrangement for them to continue paying until all the money is retrieved from the two people who were guarantors.
They have an arrangement to recover?
Yes.
Auditors, could you confirm what he just told us?
Honorable Chair, we can confirm that 15,000 has been recovered, leaving a balance of 23,883.
Okay, Mr. Chairman.
Let's go to Bompata Health Center, paragraph 323. It's on unsupported payment, 5,200. Have you supported the payment?
Honorable Chair, the payments have been supported.
Auditors.
Honorable Chair, confirmed.
The next one, Antua Health Center, is a mistake. It's an error. So we'll move to Joabin. Joabin Government Hospital, paragraph 327. Honorable Bauer.
Thank you, Mr. Chairman. And that paragraph relates to
unearned salaries. And here we have 2 staff who earned salaries that they were not supposed to. I think they've made some refund. One has made some refunds, but still we have an outstanding of 71,227 cedis. And the recommendation is that the MESUP should recover this amount with interest at the prevailing bank rate from Ayembiri Benjamin and Abuaje Ernest, or their guarantors should pay same into the Auditor General's recoveries account. What's the status of this infraction?
Yeah, thank you very much. We've so far made a payment of 8,330 by the same people who just packed their bag and went to the UK as part of the brain drain. So I think, Chair, that's part of the fallout of the brain drain, and I'm sure we might see some of such even in the next year's budget, in the audit. Upgrading some of those who are here to be able to replace them.
Dr. Jenna, there are a lot of applicants seeking to enter our health training institutions, but because of this quota system, or is it they are unable. You find schools with spaces that they could accommodate people that we could train as nurses, but they are denied because of the quota system. What are you doing about that too?
Honorable, that is the ministry is responsible for the schools. But if you are able to do a good redistribution of, and I can say that if yourselves can also assist us to make some of the constituencies and some districts very attractive, we will be able to push more health workers into those areas. But in terms of the quota system, that policy comes from the ministry, and I don't know whether they are prepared to make any statement on that.
So, in the past 3 years, we lost 4,000 nurses who have traveled outside.
4,000.
Did we fill the gap?
In the same period, we have recruited over 30,000 nurses.
Over 30,000, okay.
Nurses, so
because I know there are more nurses who are
still waiting to
be.
Yeah.
So it means that the nurses that are leaving are actually not affecting us. Maybe the experience.
Yes,
that is what we are.
Experience, but in terms of numbers, no.
In terms of numbers, no. And then what happened to the policy of exporting nurses?
Yeah.
What happened to that policy?
Exporting nurses. I think there was some arrangement that has been halted, but I believe that it may go back to see how we can get. I think there was an arrangement with the UK government. So I think some documentation has to be done. Hopefully, if it's
sometimes we make public statement, we don't follow it. We give hope to our people, then we wait, and that hope died down. You see, we raise their hope that we'll be exporting them, for them to earn a lot. Now you are not doing it, so they are exporting themselves.
In fact, they started exporting themselves very fast, above what we can do. So.
Anyway, so let's go to paragraph 329, Honorable Apak.
Chairman. Unearned salaries. The amount quoted by the auditors is 30,066 Ghana cedis. Ejiso Government Hospital. It has to do with two members of staff who were paid on earned salaries and had been living, and they have refunded some of the amount, actually. And the amount remaining is 30,066 Ghana cedis and 24 pesos. The auditors have recommended that the medical director recovers the outstanding amount with interest at the prevailing Bank of Ghana rate from Eva Aqua and Felicity Chira or their guarantors, and same be paid into the Auditor General's recoveries account at the Bank of Ghana, failing which the amount should be recovered from the medical director. What action have you taken with regards to this recommendation?
Yeah, thank you very much, Honorable. The full amount has been recovered.
Chairman, the full amount has been recovered. Auditors, can you confirm this, please?
Honorable Chair, the full amount has been recovered.
Commendable. These are steady leave matters, and the full amount has been recovered. Thank you.
Paragraph 331 is also payment of unearned salary, 66,223. Has that also been recovered? It involved Ms. Dorcas Wedi Mensah of Ejisu Municipal Health Directorate.
Thank you, Honorable. 39,000 has been recovered, and we leave an outstanding balance of 27,000, and we are still in the process of collecting the rest of the money.
All right. Auditors, can you confirm?
Honorable Chair, 39,000 has been recovered, leaving a balance of 27,223.04.
I hope this Dorcas is in Ghana or is also outside.
Sometimes you never know.
You never know, okay. But the refund is being done. All right. Agogo Presbyterian Hospital, paragraph 333, Kofi Adams.
Well, Chairman, another unearned salary, but this time is 7,584, and it involves a staff by name Miss Pascaline Kolikan. She's a senior nursing officer. The medical director was to recover the total amount with interest at the prevailing Bank of Ghana rate from Miss Pascaline, and same paid to the Auditor General's recoveries account. Have you done so?
It's a check, and I'm sure I think they are coming to respond. It's not Ghana Health Service.
Is Chuck here? Chuck?
Yes, Honorable.
Okay,
Please
all right. Kindly respond.
Where's my director, Chuck?
Have we taken the oath already?
Yes,
okay.
please. I
Okay.
did. My director, yes. Sorry, Chair. Respectfully, can the honorable member repeat the question? Because I was coming.
Okay.
But before then, let me bring you prayerful greetings and blessings from Chuck.
All right.
Yes.
Honorable, is that you repeat the question?
Well, the question is that a staff of yours at the Presbyterian Hospital in Agogo, who resigned on the 3rd of September, was paid salary for September and October. And the total amount was 7,583 cedis, 94 pesos. Your medical director was to retrieve this money from her, and at every time you do so, you calculate interest at the prevailing Bank of Ghana rate on this money. And pay this to the Auditor General's recoveries account at the Bank of Ghana, failing which the medical director and those who validated the salary for these 2 months are to do the payments. The question is, have you retrieved the money from her and interest, and how much was the interest on the 7,583 cedis?
Yes, Honorable Chairman, in compliance with the recommendation, same has been effected. Thank you, Honorable Chair.
How much was the interest on the amount? How much was the interest?
Honorable, let me validate this with my team. Let me introduce my team, Director Finance is CMC Enoch Asadade, and Director HR. So they will back me up on this.
Auditors, for purposes of time, if they can't see their figures, did you find payment of this amount plus interest in your follow-up audits?
What they actually paid was 7,584 without interest.
Director, the recommendation was for you to retrieve with interest. So what do you say to the interest component?
Yeah, Honorable Chairman, that will be a genuine error. That will be rectified soonest, having done the needful. Grateful.
Well, my attention is being drawn that we should forgive the interest, and so you are forgiven about the interest component once you've paid the actual amount that you've done. So then the auditors have confirmed. Thank you.
Yeah, very grateful, Honorable, and blessings on that concession.
Is that all for you, or you? Don't go now. I think the way the report is captured, you might come up again. So we have not discharged you fully. Let's move on to the next one, which is actually unsupported payment. The first one is District Health Directorate, Kwame Danso. Honorable Yusuf.
Sharon, thank you. The infraction is that the district raised 3 PVs totaling 16,360 Ghana cedis. By the time of audit, you were not able to account for 3,350 Ghana cedi. Has that now been accounted for?
Honorable Chair, it's been accounted for and submitted to the auditors for verification.
Auditors, can you confirm?
Honorable Chair, confirmed.
Chairman, we are good to go.
The next one is Bantama Chips Compound, paragraph 335. The amount that has not been accounted for is 3,800. Has it been accounted for now?
Honorable Chair, has been accounted for.
Auditors, can you confirm?
Honorable Chair, confirmed.
The next one is Drobo Chip Compound. The amount is 2,500. Has it been accounted for?
Honorable Chair, has been accounted for.
Auditors, confirmation.
Honorable Chair, confirmed.
The next one is Shami Chrome Chip Compound, paragraph 335. Honorable Ajay Boatin.
7 PVs, amount paid 20,590, but 19,490 has not been accounted for. Has it been accounted for now?
Honorable Chair, they've been accounted for.
Auditors?
Honorable Chair, they have been accounted for.
Thank you, Chairman.
Thank you. The next one.
With unsupported payment. Amount is 50,690 Ghana cedis total. But for Lassie itself, we're looking at 5,000 unaccounted for. What's the update on that one, please?
Which has been accounted for.
Chairman, that'll be it.
Auditors, any confirmation?
Honorable Chair, the amount has been fully supported.
Okay, the next one is Lemu chip compound. The amount is 5,500. Has it been accounted for?
Honorable Chair, has been accounted for.
Auditors.
Honorable Chair, confirmed.
Bato, unsupported document, and the amount is 11,050. Have you gotten the supporting document, or have you accounted for them?
Honorable Chair, we've accounted for them.
Auditors, please can you confirm if the money has been accounted for?
Honorable Chair, the amount has been supported.
Thank you, Chairman. That will be all.
Okay. Now, paragraph 338, Honorable Queen Star, Abrefi Hospital.
Thank you, Chairman. Payment of unearned salaries to 4 institutions worth totaling 253,709 to Abrefi Hospital, Ahmadiyya Muslim Hospital, Atebubu Municipal and District Health Directorate. And the recommendation was for the head of the institution to recover the amount with interest at the prevailing bank rate. Has it been done, please?
Honorable Chair, for Abrefi Hospital, which is under us, 37,204.23 Ghana cedis have been recovered, leaving a balance of 49,340, which we are still working to recover.
Can the auditors confirm for me the Abrefi Hospital?
Honorable Chair, a total of 37,204 has been recovered, leaving a balance of 49,339.
Are you putting any effort to pay the rest? What effort are you putting?
Yeah, we are working with their guarantors for them to pay. Because most of these people are not in the country.
Yeah, I'm done. They are not in the country, sir.
The next one is Ahmadiyya Muslim Hospital, paragraph 338. It's also on earned salary involving 3 staff. What is their status?
Thank you, Honorable Chair. In fact, Honorable Chair, I think the way the issue had been captured, our recommendation never got to us. I think it was mistakenly sent to Ghana Health.
Order.
It was mistakenly sent to Ghana Health Service. We only got reading of it. That was just this Thursday. So we quickly went to the ministries and then to fetch certain informations. Thankful Dr. Zahir Safadi, who owes around 91,000 cedis, was a doctor who was posted to one of our facilities in Techima
He reported, we have documents to that effect. He only resigned in December 2019. So we had asked the IPP department to furnish us with his pay slips from December 2019 to March 2022, as per the reports. And he also claimed that the bank he was using had been liquidated, but we were given the assurance.
Honorable members, let's listen to the answer.
But we're given the assurance from the IPP department of the Ministry of Health that even if the bank was liquidated, some of the banks were consolidated into some one bank or so they can still trace it and see if really he has received those salary. Then we'll follow up with him and then see how best we can retrieve those monies. With regards to the other two nurses, they have traveled out the country. We made some few calls to them yesterday, but they weren't picking. So we are trying to liaise up with the families of these nurses in Techima.
Please, I'm a bit curious. You said March 2019 to 2022. Am I correct? For doctor?
No, I said he resigned in December 2019. But
Yes.
the reports covered October 2018 to, I think, March 2022.
So
The report covers October 2018 to March 2020.
March 2020.
Yes,
Okay.
March 2020.
Sorry. Thank you.
So it means that the 91,000, which is captured here, might not be the
exact figure.
the correct figure.
Yes, please.
If you do the reconciliation, the figure will come down,
Yes, please.
depending on which month of 2019 that he resigned. So December. So it means that the actual unearned salary will be 3 months.
Yes, please.
January, February, March of 2020.
Yes.
But we need to do that reconciliation first.
Okay.
With auditors. They will know the amount that we should recover from Dr. Safari.
Thank you.
All right, so you haven't done anything apart from what you have explained. So you need to work hard. So we are giving you 2 weeks to give us a feedback through the district auditor of the where the hospital is located to be forwarded to the headquarters of the audit service, that we can know what action you are taking on this infraction.
Most obliged, sir.
So the next one is Atebubu, Municipal Health Directorate. Honorable Akwesi Konelu.
Thank you very much, Mr. Chairman. Mr. Chairman, this has to do with two separated staffs who received salaries for 3 months that the auditors say they unearned those salaries. And that is Samarat Ali and Regina Esubontin. They both received salaries for 3 months that they did not earn. And the recommendation is that this amount be recovered from them and paid into the AG's recovery account with the Bank of Ghana, failing which the amount should be recovered from the heads and the validators. I would want to know the status of these two individual recoveries each.
Thank you very much, Honorable. We have Samarat Ali and Regina Subontin. Ali's bank, that's the Fidelity Bank, said the woman had withdrawn all her money from the account at the time. Out of the, and that only 306 had been paid out of the 5,134 that was paid into his account. In respect to Regina Subontin, the Societe Generale, which is his bank, has agreed to pay, actually paid 2,590 into the account, waiting for the outstanding funds to be paid for.
That's DG. If I may ask, have you tried contacting any of these two individuals?
Yeah, we are engaging their guarantors.
And what are they saying? Because this is a 2021-2022 unearned salary, and the report is for 2022. We are in 2024.
Yeah. So that's why the first transfer was paid. That is Ali paid on the 17th of October last year. So we continue to engage them to see how we can retrieve the rest of the money.
But I guess Ali's own, you said Fidelity said she's withdrawn all the amount and they only transferred 300 Ghana cedis. Was it transferred by the bank or she paid?
Can you, excuse me. Yes, the family has agreed to refund the money. So I presume that payment is coming from the family.
The 300 cedis?
No, the 300 was the balance in the account.
So how much has the family paid?
5,134 paid into the Auditor General's recovery account.
So that means all the amount has been recovered? Because the amount outstanding is 5,134. So if
yes,
the family has paid,
yes, that has been paid.
That has been paid.
Yeah.
So that means she's paid in excess. Because there was 300 transferred from her account.
300 was what was the balance in the account.
So that one was left there.
Yes.
And the family has paid 5,100.
Yes.
Okay, so that one is gone. And Regina Subontin, what agreement has been reached with the guarantors?
They so far paid 2,590. That's from the bank.
That's from the bank. And the guarantors, nothing?
Nothing yet. But we are engaging them to see how the rest will be paid.
Auditors, can you please confirm the refund of the 5,134 Ghana cedis in respect of Ali and that of 2,590 in respect of Regina Subontin?
Honorable Chair, we may have to do some reconciliation with them because what we have is a 300 that was refunded by Ali Samaret. That is the only evidence we have at the moment.
DG, the auditors said they only have the 300, which in our discussion, you just made me realize that that amount is what was the balance in the account, but not the transfer to the recovery account, but the 5,000 payment by the family. This is at variance with.
We will reconcile that with the facility and get back to you.
Chairman, I think that is where we are. No recovery has been made in respect of Ali and Regina Subontin. Auditors, what about the 2,590 in respect of Regina Subontin? Not, Chairman, both, nothing has been refunded.
It looks like this unearned salary is becoming a problem, especially with the health sector. The health sector unearned salary is becoming a problem. All right, so the all right, let's move to the next one. That is a District Health Directorate, Prang. One Osla Ajwa Konedu, 13,744. Have you recovered this money?
Honorable Chair, so far no recovery yet. We're still engaging the bank.
So you're having a lot. So, Clark, take note of this. Health sector is becoming a challenge in terms of unearned salary. We have to find a solution to it. So make a recommendation what should be done.
Honorable Chair, what we've so far done is that we have issued for the validators that on the 10th day of the month, those who supervise people should complete a form to the validators that these people are still working before they are validated. And we believe that will help us cut off those who are earning salary illegally much faster than people just find out when they need it. So that's what we have put in place.
So if a validator wrongly validate or
Then
knowingly
yes,
that this person is not around but still validate, any punishment for that validator?
Yes, they will be surcharged.
They will be surcharged.
Yeah.
All right, let's move on to the next one. Nsoatre Health Center, paragraph 340. Honorable Isaac Opoku.
Thank you, Chairman. Chairman, this is an interesting one. Deployment of staff to private health facility. Chairman, 5 staff were posted directly from the Regional Health Directorate to a private health facility, Amponsa Maternity Home. And between December 2020 and March 2022, the 5 officers were paid a total amount of 154,754. The recommendation is that the said amount should be recovered from, plus interest, should be recovered from the persons involved and pay same to the Auditor General's recovery accounts with the Bank of Ghana. Chairman, I want to find out from the auditors. These, yes, before I even ask whether the recoveries have been done, these postings were done by the directorate. So why are we, asking the beneficiaries to refund the money?
I think the answer I will give you that they benefited from the payments. They were paid those salaries, and they were not working for the state. They were working in a private facility. So the amount should be recovered from them.
No, but Chairman, my concern is that the postings were sanctioned by the directorate. The directorate posted them. So I thought the amount should be recovered from the private facility and not the individuals. Shouldn't be blamed. The posting was done directly from the Regional Health Directorate. Yes. Yeah, may I know what category are these officers? Are they medical? Are they doctors, nurses?
Honorable, thank you very much. They were nurses, and these were part of the deployment strategically during the fight against COVID. And so, February 2022, they were withdrawn. And in most parts of the country where we needed support in treatment, we posted people here in Accra to private facilities just to provide some of the backstopping that we needed to support them. So that was strategically posted to do that as part of the COVID response. And that's why when they were able to recover, they withdrew them.
Great. So what is their offense?
I think they were posted by, as you said, by the region for a purpose. And that has been done. That was a public health emergency. And in public health emergency, we deploy anywhere that people need to be deployed to.
I agree. So why should they refund, the money? Were they paid double?
No.
Yes, so what is, I don't really understand, Mr. Chairman. I don't know why we are asking the beneficiaries to refund.
Well, I think that maybe the auditors were not well briefed. That it was a policy to deploy nurses to all facilities to fight for the purpose of the COVID. Because the auditors reported this because these people who were paid by government work at a private facility. By that, those private facilities should have paid them. But government paid them. That is why they are asking that they refund the money. Or the hospital, the private hospital, pay to government. But now we are getting the reason why such was done. But at the time of the audit, I think that the auditors were not briefed. If they were briefed that, oh, this is a policy of government to deploy these people to this facility because of COVID, I'm sure they wouldn't have recommended for a refund of the money. But this policy, is it something that was done across the whole country?
Yes, sir. There are many facilities where, because of their location, we had to go 10,000 plus health workers who were paid as frontline. I wouldn't know, but I'm sure they will be part of the team of who benefited from the frontline workers who were paid.
Anyway, the COVID report is there. We'll be taking it this year, so get yourself ready.
I'm not done.
Yes.
I want to find out what is the updates. Did you write to the beneficiaries to refund the money?
Honorable, our response was that they were strategically posted to those places, so we were taking so we were not writing to them to refund any money, and that's why we don't made any effort to recover the money from them.
Auditors, are you privy to this information?
Honorable Chair, we are hearing it for the first time. With the CHARC arrangement, CHARC is not a government entity, but there's that policy there. We didn't have any policy with this particular one, and that is the reason why we raised the issue. So we are now being told that there is a policy in place. If we can have access to documents to that effect, then we can validate it.
DJ, do you have a policy document to this effect?
Honorable, we wouldn't have any specific policy document, but as part of our public health response, it's part of the strategy for response. We sent nurses to the airport and many places to work there. Treatment centers, somewhere.
So we are going to take your words.
Yes, sir.
As a Director General, you are telling this committee that as a response to COVID, even though there was no specific policy document, you had to deploy government paid staff to private facilities to work.
Yes, sir.
All right, so auditor, clerks, take note of this. It's important for us to comment on this in the report. All right, the next one is Sunyani Regional Hospital. Paragraph 343. It's up again on payment of unearned salary, 19,627, involving 3 staff. Fosu Hima Naomi, Osu Safo Regina, and Ewa Bafo. The 4th person is Rita Ejiriba Hansen. The total amount is 19. Have you recovered this amount from the 3 staff and then the 4th person who is deceased? The 3 are vacated posts. The 4th is disease. So have you recovered the money from them?
Yeah, thank you. No, we recovered 13,031 cedis, and the bank, Fidelity Bank, has been instructed to remit the August at the same page to the Auditor General recovery account.
So what is the total amount that the bank remitted.
Check. Yes, they paid the. We will have to. I mean, you have the breakdown.
So 13 has been Honorable Chair, 13,031 is what has been recovered. And
okay, auditors, can you confirm 13,031 recovered?
Honorable Chair, 13,031 recovered.
It's a balance of 6,000.
Balance of 6,596.
Okay. So you continue to recover the full amount. The next one is paragraph 345, payment of salaries to unknown staff, 1.9 million. The auditors noted that their headcount of personnel revealed that 95 unknown names were validated and paid salaries totaling 1.922 million between January and December 2021. The Human Resource Manager, Mr. Nicholas Opon, explained that the officers were placed on the hospital's electronic payment voucher, ESPV, by the regional directorates, and that the officers were unknown to the hospital. The auditors recommended that the Director General should ensure that the regional director and the medical director recovers the amount of 1.922 with interest from the affected persons and pay same to the Auditor General Recovery Account. Having been able to recover the 1.9 million from the 95 unknown names.
Thank you, Honorable. There were in total about 95 such staff. We have what we call vacancy creation. And so when they are being posted, we work with Public Service Commission to create the vacancies. If there are no vacancies created, we put them where vacancies, otherwise they cannot be processed. Where they can be, vacancies are, and then they are placed somewhere else. But when we reconcile, then their salaries are moved back to where they are supposed to be now. Otherwise, we will not be able to process them. And it was taken, but now we've been able to process all those vacancy disparities now. We had identified all of them. 91 had earlier been identified. There were 4 that was outstanding that we found them. And that happened because at the time, they were found in a Ahafo region. At the time that they were posted there, it was Bono Ahafo. And they were now managing the HR from one center. So when the auditors went, they did not have access now to Ahafo data. So those 4 could not be accounted for. But we found them that there was one was a lady who had passed in December 2020, but the salary was stopped in February. And we had a Samoa Anima who had vacated post, but that also his salary had been stopped the very month. And then the other one too had also resigned, and their salary had been found. So all those 95 people were found. And the challenge, as I said, was that they were placed in the Sunyani, but that's where the vacancies were, but they were working somewhere else. And I worked with the district auditors to identify them. The last one was the 4 that we were finding difficulty to identify, but we finally found them in, I think, Bichim, in Ahafo, Bichim and other places.
All right, so auditors, can you confirm that the 95 unknown persons have now been identified and that there were not salaries paid to people who did not earn the amounts?
Honorable Chair, we can confirm that all the staff have been identified. They are not known.
Okay. All right, so let's move on to paragraph 3.
I just want to find out, why is it that 68,228 Ghana cedis, 47 Ghana pesos, was paid for a VW Trendline Amarok pickup that has not been supplied? Is it that the money has entered into the voicemail of the Ghana Health Service, or it is that the Sunyani Municipal Hospital does not need a vehicle they've paid for?
Honorable Chair, so this is one of the vehicles which were not supplied by the supplier after the deposits were paid. And as some of who yet written to us paid, and as some of who yet written to us, but we have decided that going forward, we are going to refund all the outstanding monies to all the facilities, irrespective of whether they write to us or not.
I'm just interested in the fact that you know the thing didn't work and you are waiting for them to write to you before you refund their money. If they owed you, you would have gone for the money long time. But their money is with you and that's why you're not refunding. In this case, have you refunded?
In this particular case, we have not yet refunded.
So when are you refunding?
By close of next week, we should refund all those monies because the money is there. Yeah.
Chairman, I would want the committee to take note of this pledge. He has bound himself by end of next week for him to furnish the committee with proof of the transfer back to Sunyani Municipal Hospital by end of next week. Chairman, I rest. Thank you.
Thank you very much. The next infraction is on paragraph 351, and that'll be taken by ranking, please.
That is for Nurses and Midwifery Training College, Sunyani. Are they here to respond?
Have you been sworn in? Okay, introduce yourself to us, please.
My name is Victoria Moore, the principal, Sunyani Nursing Training College. And with me is my accountant.
My name is Nyakufo Jokinsford, the head of finance.
Yeah, the case of the auditors is that two of your programs has not been accredited as at they expired on 31st May 2022. Have they been accredited now?
We have all the certificates.
You have been accredited now?
Yes, please.
Okay. Auditors, can you confirm?
Honorable Chair, the accreditation has been secured now.
Okay, that will be all. Thank you.
Thank you. The next infraction is on paragraph 354 and Sunyani Medical Services, and it's by Honorable Amakwata.
Thank you, Honorable Chairman. Careful. Thank you, Honorable Chairman. This infraction also borders on undelivered vehicle. The auditors found out that Sunyani Regional Medical Stores took advantage of the policy of the Director General for health facilities that are interested to take advantage of high purchase system by initially paying 15% advance for vehicles to be supplied. The facility paid 208,175 cedis, 78 pesos, into the health service high purchase account for 4 VW pickups, but were not delivered, not even one. What is the state of the situation as at now? Has the vehicle been delivered, or has the amount been paid back? Thank you.
Thank you, Honorable. I think it's part of the package of arrangement was made for the high purchase vehicles. Because we were having difficulty with delivery, we had asked that they stop paying further installments against the delivery, and we are waiting for, I think they said they've written to us so that we can refund their money to them. We have still not given up on trying to see whether we can get a different arrangement for those cars, and that's why some of the facilities are still interested in keeping their money with the hope that they will get the vehicle when it comes.
Yes, I was going to come to that, because obviously, even on the face of it, you know, the policy put in place is a laudable one, and all of us must applaud it, because with establishment, cars are supposed to be working tools. So I'm sure, as Director General, you put up this brilliant policy to aid all facilities in their work delivery. So it's a good policy, and I will urge you, Mr. Chairman, I will urge you that no matter the difficulties, don't abandon it. As you have suggested yourself, if a supplier failed to deliver, you may try other sources, because obviously the idea behind it is good. So keep it up. Thank you. Thank you, Mr. Chairman. Thank you very much. The next one is paragraph 358. It's on Seventh-day Adventist Hospital, Sunyani, and it's about bond defaulters. There are 4 staff involved. Kobina Abuaji, senior staff nurse. Ophelia Yeboah, senior enrolled nurse. Adom Mavis, enrolled nurse. And Augustine Boama Boatin, senior staff nurse. All these people were bonded, but they defaulted in serving the bond. So the recommendation is that the Director General of Ghana Health Service should recover the amount. The total is 219,052 Ghana cedis, 61 pesos from the 4 defaulters. Director General, can you update the committee on this?
Well, I think that is a CHAC facility, so they will.
Okay, so CHAC.
Yes, Honorable, we work together with Ghana Health Service, so I thought, but that's it. Director HR will answer.
You are here, so.
Yes, okay. Yeah, thank you, Honorable Chair.
Can you mention your name?
I'm Samuel BK Nugblega, Director of Human Resources for CHAG. No recovery had been made, but we are working with the Criminal Investigation Department of the Ghana Police Service, Sunyani, to get the defaulters. And they have commenced the processes to get Interpol involved so that we can get these people pay the money.
So, Director General, you realize that this issue, bond defaulting, it cut across even to CHAC institutions. When was the last communication with CID of the Ghana Police Service?
No, it was July. The last communication was on the 5th of July 2023.
That's in far. It's over 6 months.
Yes.
So you don't have any current updates?
No, the current update, as they have communicated to us, is they are at the point of publishing their photographs in the dailies and also in the television before they get the rest of the processes on.
What is preventing them from doing that?
And secure court order to be able to do all of this. And all of that had been done now.
Okay.
And they are at the point of publishing their photographs.
Okay. So we'll all monitor to see if they will publish it. And if they publish, kindly furnish us with the publication.
Thank you.
The next one is Sampa District Health Directorate. Paragraph 362, Honorable Ranking.
The infraction is overpayment of transfer allowance. The amount is 17,723 cedis. A staff by name Mr. Jacob Kojo Aleba was paid transfer allowance over and above his entitlement. The difference is 17,726. Management has responded that the amount has been refunded to Yoko, but he didn't receive any receipt from Yoko. So the recommendation is that you should get a receipt from the Yoko to authenticate the payment. Has it been done?
Yes, sir. That has been done.
Can you confirm, Auditor?
Honorable Chair, confirmed.
All right, paragraph 266, Banda District Health Directorate. Vice Chairman.
Thank you very much, Mr. Chairman. Now, we are talking about unutilized health support fund of 275,000. Has this amount been utilized now?
Yeah, thank you very much. It's been utilized for construction of a 3-bedroom nurses' quarters. So far it's been done.
Can the auditors confirm, please?
Honorable Chair, the contract has been awarded and the project is ongoing.
I thought you said it's... Director General, you said, I thought that the project was completed.
The project, the money has been utilized.
Okay.
I think I account for about 40.
Okay. I will leave it at that. Okay. Thank you.
Paragraph 6369 on earned salary. 5,003 Ghana cedis was paid to Mr. James Akonaga for no work done. You have to recover the money from him. Has he paid the money?
Yeah, full recovery made, Chair.
Auditors.
Honorable Chair, the amount has been fully paid.
Okay. Paragraph 371, Honorable Roxon.
Chairman, thank you very much. When she Methodist Hospital, do I have your attention? Now, the case of the auditors is respect of some unpaid bond value appears to be a problem running through. What's the situation now?
Thank you, Honorable Chair. I'm Enoch Osei Adade, Director of Finance, CHAG. The current update on the Wenchi Methodist is the full amount has been recovered, and I have the document here yet to be given to the auditors to confirm. So I have them here. Everything recovered. Thank you.
Yeah, it's good news, but going forward, anytime you do this, ensure that you give it to the auditors, because they are supposed to verify whatever you submit to them for purposes of our work. So auditors, if you may receive copies for verification and subsequent submission. Chairman, that will be all for them.
Paragraph 375, Honorable Bauer.
Thank you, Mr. Chairman. And tying this hospital, this has to do with unpaid bond value, the same issue. And we were supposed to, the recommendation was that an amount of 64,306.20 with the prevailing Bank of Ghana interest rate was to be recovered from one Joseph Jechi Bamfo or his guarantors, and same paid into the Auditor General's recovery account. Has that been done?
Honorable Chair, the officer who is a physician assistant is disputing the unearned salary because he worked, he served the bond between September 2019 to March 2021. And this is confirmed by management of the facility. So he refunded 4,000 to the Auditor General's recovery account.
No, and did you bring this to the attention of the auditors that the said officer is disputing the amount and that he served, as you are saying? Have you made this available to the auditors?
My understanding is that they are yet to bring it to the district auditor's attention. The national auditor's attention. Yeah. But at the district level, they have brought it to the attention of the auditors.
Now, auditors, can you confirm this from your districts?
Honorable Chair, the status we received from the district indicates that 4,000 has been recovered, leaving a balance of 60,000. As to the dispute, we are yet to be informed about it.
So, Chairman, your directive on this?
So it means that the hospital did not actually reconcile this with the district auditor, because the feedback from the district auditor to the headquarters is that the balance is still outstanding. So if the reconciliation was done, they would have communicated that to the headquarters of Ghana Audit Service. It means that you have to go back and do the reconciliation with the district auditor and for them to confirm that truly the officer has worked for the period. Paragraph 278, Honorable Apak.
Doma Presbyterian Hospital, unearned salaries, 12,179 Ghana cedis. According to the auditors, this was paid to one Daniel Asante, and they have provided the staff number of the said Daniel Asante, who vacated post from October 2020 to January 2021. They have recommended that the medical director recovers the said amount with interest at the
Honorable Chairman, recommendation implemented as directed. Thank you.
Auditors, your recommendation has been implemented as directed. Can you confirm?
Honorable Chair, the total amount has been recovered.
Chairman, the total amount has been recovered.
Thank you. The next one, paragraph 380, unaccounted payments, 34,945. It involves a number of PVs. Have you provided the supporting document?
Honorable Chair, we've provided the supporting documents. And these have been verified by the auditors.
Auditors, can you confirm?
Honorable Chair, confirmed.
Good. Paragraph 382, Honorable Kofi Adams.
Thank you very much, Chairman. It's also an earned salary, and like you said, it's becoming a ringtone. 4,143 cedi paid to Charles Vigbedo, and the the regional director was to recover this money and pay to the Auditor General's recoveries account. What has happened to this issue?
Thank you very much. The money has been recovered. Everything has been recovered.
Auditors, can you confirm this?
Amount fully recovered.
Vigbedo. Is a child when you send him to send it on errand, he refuses. He doesn't respond. And the next one is paragraph 384. Honorable Yusuf.
Thank you, Chairman. Chairman, the infraction is that about 33 members of staff occupying government bungalows and flats are defaulted in rent payment, totaling an amount of 76,830 Ghana cedi. May I know the status of this infraction?
Yeah, thank you very much. 29,837 has been paid, leaving a balance of 46,993, and efforts have been made to get them to refund the rest of the money, sir.
Director General, when you say effort is being made, what kind of effort are you talking about?
I mean, the work at the directory, the regional director has given them order. They probably make some instrumental payments as they did for the first one. We are hoping that the same policy that is used in...
You are just keeping long, and these are your staff. Why don't you deduct from their salaries? Because these bungalows, we need to maintain them so that, you know, they don't get deteriorated. And if they are not paying, how are we going to maintain them? So I would have suggested that once they are taking salaries, you find a nice way of deducting from their salaries, mindful of the fact that, you know, they should still have something substantial to be able to live on. What do you think about that? Auditors, are they saying that some 29,000 has been paid? Let's find out from you.
Honorable Chair, 29,837 has been recovered, leaving a balance of 46,993.
Chairman, that's the status of it, so we are good to go.
Paragraph 387, Abouaka.
Thank you very much, Chairman. The accountant failed to remit taxes amounting to 29,800 to the GRA. I'd like to know if the said taxes have been remitted. Thank you.
Honorable Chair, all the taxes have been remitted.
I would like to know if you go to the recommendation, it says any penalty arising should be paid personally by the medical director and the accountant. I would like to know if there was any penalty, and if so, have they been paid by the director and the accountant? Thank you.
There was no penalty.
All right, auditors, can we confirm if the monies have been paid?
Honorable Chair, the taxes have been remitted, the entire amount.
Thank you, Chairman.
Thank you very much. Paragraph 390 is about private health insurance indebtedness. So for Efiankwanta Regional Hospital, these 8 private health insurance companies owe the hospital a total amount of 264,285. Have they refunded the money? Have we be able to collect the money from them?
They've refunded them and we've collected the monies from them.
Auditors, can you confirm?
Honorable Chair, confirmed.
Okay, the next one is paragraph 393. Honorable Ajay Boateng.
Thank you, Mr. Chairman. 393, this one is Ezekado Government Hospital, and it's unsupported payment amounting to 91,306. There were 41 payment vouchers which were not adequately supported with the relevant expenditure documents. What is the situation now?
Robert, all the documents have been fully supported.
Auditors, can you confirm?
Honorable Chair, the payment has been fully supported.
Good to go, Chairman.
Paragraph 396, ranking.
It's about an NSARS with about 7 staff, totaling 80,952 cedis and 97 pesos. Have these amounts been recovered now?
Honorable Chair, after reconciliation with the auditors, we came to an amount of 67,176.61 Ghana cedis as the on-earned salary instead of the 80,000. And out of that, 13,884 Ghana cedis have been recovered, leaving a balance of 53,292.58 Ghana cedis yet to be recovered.
That's very small. Why? What is the problem?
They are out of the country, and actually we have reported the matter to the police Interpol to help us trace their whereabouts.
This on-earned salary thing, we need to have a solution. Yes, we need to have a solution. It's a big challenge because we are doing verification every month. If you are doing it, you should be able to know. You should be able to know within a month that somebody has vacated the post or something. What is the challenge, Director General? What is the challenge, or accountant?
I think, as we indicated, we have introduced a control with the forms such that on the 10th of every month, the heads of departments fail to indicate who is present and who is absent and submit to the validators. So this going forward is resolving the issue somehow. But what has happened now is what happened before this control was introduced. Most of these people, they go on leave, which is legitimate, and then after their leave period, they don't come back. Sometimes when they go on leave, maybe a week, 2, or even the month after the leave, sometimes you want to bill. But as we said, going forward, we are ensuring that now, if the person goes on leave and the leave period ends, the salary stops if the person has not reported.
All right.
Let's
hope that it works.
Paragraph 399, Honorable Sampson.
Thank you, Chairman. Salary advance, 25,000 outstanding, 16 workers. Have we recovered the amount?
Honorable Chair, is fully recovered.
Auditors, can you confirm?
Honorable Chair, confirmed.
Thank you. Paragraph 402, unremitted withheld taxes, 23,831. Has this amount been remitted?
Honorable Chair, they've been fully remitted.
Auditors, can you confirm?
Honorable Chair, confirmed.
Okay, next one, paragraph 405, outstanding tier 2 contributions. The amount is 20,441 for August 2021 to July 2022. The recommendation is that the medical soup should ensure that the deducted pension contribution is remitted to the fund manager. Has this amount been remitted?
Honorable Chair, it's been remitted.
Auditors, can you confirm?
Honorable Chair, confirmed.
Paragraph 408, Honorable Dakwa.
Thank you, Chairman. So I'm Hafasini. I think your paragraph 408 also has to do with unremitted tier 2 mandatory contributions. So the Auditor General noted that management failed to remit the 5% tier 2 mandatory contributions of its casual workers, totaling 17,650 Ghana cedis. That's for the period of July 2021 to August 2022. The auditors recommended that the medical superintendent should ensure the outstanding contributions is remitted to the fund manager. Can you tell us if this has been done and the full amount of 17,000 has been remitted?
Honorable Chair, this has not yet been remitted. Actually, the facility has written a check to the bank, but the payment is not going through. The feedback we are getting is that the bills are not being generated by enterprise insurance for the bank to be able to pay. So that is a challenge.
So what are you doing to resolve that?
They've written several letters to the bank, to enterprise. I have them here. So there's been correspondences and follow-ups, but they are not making much progress.
No, but I don't think they are not making much progress is the right way forward. I think there should be at least a plan as to how these monies are going to be remitted. And for me, I don't think your answer is satisfactory. I think I'll yield to Chairman. So the Chairman, so the amount of 17,650 is still outstanding, and we are asking for a way forward. And I think the way forward is not too clear for them. So I'll yield to you, Chairman.
Let me ask a question. Accountant, I don't really get you. Are you saying that you are prepared to pay the money, or you have actually issued a check and enterprise is not interested in taking the money? Is that what you are trying to say?
We are prepared to pay the money. We have issued a check to the bank. When the check goes to the bank, the enterprise, from our understanding, is supposed to generate a code to create a bill for the bank to pay. And that is what they are having that technical hitch.
So the check went to which bank?
Ghana Commercial Bank in Hafasini. This is since July 2023.
What is the problem? Is the enterprise no more interested in the business or what?
Actually, Tier 2 is paid to enterprise by almost all our facilities. So this is a peculiar problem.
Yeah, but it's not. It means that the funds of the workers are not being invested and they are not getting their interest or whatever. It's not fair. It's not fair to the workers because of bureaucratic or whatever systems. You have to do something about it. Are you under obligation to do business with Uli Enterprise?
I think that is the case because yesterday there was an issue on this Tier 2. It was Enterprise. So it looks like all of you are doing business with Enterprise. They might have a lot on their hand. But if you don't have any obligation to work with Enterprise, why don't you look for another fund manager? Unless you are under obligation to work with Enterprise.
This is mainly arranged by the unions. I think the Health Services Workers Union.
Are they aware, the Health Services Workers Union, is the union aware that there's an issue of Enterprise not accepting this transaction?
Honorable Chair, not that I'm aware of, but
so,
we would, sorry.
So I'll let them know this is a challenge we are having with the Enterprise insurance as a fund manager. Okay. So that if they are the people who choose or select the fund manager, they should have a second thought on what to do. So yours is to pay the money.
Yeah.
Yes. So I'll let them that you're having this challenge.
Noted, Honorable Chair.
Okay. Paragraph 410, Honorable Akwesi.
Thank you very much, Mr. Chairman. Mr. Chairman, this infraction has to do with the Municipal Health Directorate in Asankragua. Yes, and it has to do with on-end salaries. But this is not posting to private health facilities in COVID period, nor is it separated staffs. But this has to do with staffs that went on steady leave without approval. And there are 5 of same at Asankragua Municipal Health Directorate: Prinsella, Mensu, Hannah Obey, Beatrice Safo, Mavis Anuve, and Christiana Amma. It is said that these amounts be recovered from them in the absence of approval letters for them to be granted a steady leave, and same paid to the Auditor General's recovery account of the Bank of Ghana, failing which the heads and the validators must be made to pay these amounts. What is the status of these recoveries with these 5 individuals?
Yeah, thank you very much, Honorable. The process of the steady leave, for example, those who go on leave this year, the letters are already gone, giving them provisional admission, waiting for them to confirm the admission, and they go. I think we have probably there were administrative challenges that someone had not converted the provisional one into giving them the final approval, which should be on their file. But they were all legitimately approved to go on leave. And that comes from the national level. And the list to be sent to them when the time comes and you're able to show that you actually have an admission. So I think so we're trying to see how we can get that quickly, because sometimes there's a delay in converting that paper onto that. Some of them start school in February, January, some are in September. I think we've noticed that delay, and we are putting systems in place to make sure that as soon as the person that provisional list is supposed to be converted by the region into a confirmation and placed on your file that you've had received. I think they didn't find them on their files at the time the auditors were there.
DG, are the letters on their files now?
They should, yes, they are.
And has that been shown to the auditors for confirmation?
Yes.
Auditors, can you please confirm for us?
Honorable Chair, we can confirm that they have the approval letters now.
Okay, thank you very much, Mr. Chairman.
All right. Paragraph 413, Honorable Isaac.
Thank you, Chairman. Chairman, this is similar to the one I handled earlier on. It's salary payments to staff at private facilities. And Chairman, 60 health officers were posted to 4 private hospitals. And between October 2021 and August 2022, 51 out of the 60 were paid an amount of 1,609,397. And the recommendation is that the said amount should be recovered from the regional health director and pay same into the Auditor General's recovery account. And the second recommendation is that the officers should be recalled and reposted with immediate effect. First of all, I want to find out from the Director General whether the postings were done upon request. Chairman, I'm asking that because one private hospital, Samates Hospital alone, as many as 46 staff were posted. And I'm wondering whether you were not creating overcrowding in that hospital, especially during the COVID era.
Thank you very much, Honorable. This is the summer text is a very complicated issue, and so we will give summary, and the regional director, Dr. Foyebo, will give the full report. The summer text happened to be in a location where access is very poor, and we don't have any facility there. And they are the facility that have been taking care of all the people in that community. More than 95% of the people they see are community members who have nothing to do with the bank. This came up earlier, and upon withdrawal, even the assembly has written to us pleading that we must, otherwise the healthcare in those communities will be affected. What we need to do is to see how we can reconcile and get some arrangement. Until we are present in those communities, it will be unfair for us not to serve them. But the regional director is here to give full details of what they've done and how we intend to proceed with that. And with your support, I think we'll be able to address the challenge.
Samates is located at Samraboy, right?
Yes.
Thank you.
Yes, thank you, Chair. Summerboy has a population of a little over 25,000. And the distance from the facility to the nearest major facility is 40 kilometers. We are talking about 40 kilometers of untarred road, very difficult to access. And the Ghana Health Service has no major facility within this catchment area. We don't even have a health center. It's only chip zones, which obviously cannot provide the sort of services that are needed by the people in the area. Now, apart from serving Summerboy itself, we have 2 health sub-districts with a combined population of about 41,000. That is also covered by this facility. In addition, it also acts as a referral facility. In addition to this, Summerboy also provides services to the northern part of Elembele. So it's a very crucial facility. Originally the facility was set up to provide services to only its workers. But we don't have any major facility there. So they are helping to reduce deaths of our mothers, our children, and all the people.
Chairman, I think the explanation is satisfactory. It is that
maybe it's satisfactory to you, not to everybody. I have some few questions to ask.
I'm not done.
You continue. Based on the explanation given, I want to get some clarification. Is the man not a businessman?
It is a company. Summerboy is a company. It's not like an individual.
Samatex.
Sorry, the Samate Hospital.
It's a company.
Yes.
It's not a private hospital. It's not a private hospital, is it?
Well, yes. Has filed.
Is it not there to make profit?
Originally, as I said.
No. Answer my question. Is he set up the hospital to make profit or to provide social services?
Well, it's corporate social responsibility that is providing.
No.
Originally, as I said.
No,
Mr. Chairman,
wait, please. Don't defend this. Okay? We are here to solve problem. Don't behave as you are the one who is there. Don't dodge the question. The man is a private businessman. He has established a hospital, and I'm sure he is charging a private rate. He's not controlled by the rate that you, the Ghana Health Service, give to all your facilities. No. If it's going to benefit like the CHAC institutions, then it should apply to be put under the CHAC institutions so that he can be covered by the rate that we have with CHAC. If you are charging your private rates, why should we give you the staff free of charge? We pay for it. That is the point. So it's better you have an arrangement with him that, look, we are giving you nurses that government is paying. So you must also charge the people this rate. Until you do that, he must be made to pay for the staff we give him. Honorable Yusuf.
We want to get clarification, then you continue. I'm a little bit surprised that the regional director will have so much enthusiasm in trying to justify why these huge numbers have been transferred or posted to this private institution. The question to ask is, what criteria do we use in setting up government facilities, government hospitals? If you have these data that 25,000 plus or people are underserved, okay, one would have thought that your recommendation to the Director General and the Ministry would be that we should quickly set up a health facility in that area rather than transferring or posting government staff to a private facility. I'm a little bit surprised about this kind of justification. Have you made any efforts in terms of recommending to the Director General and the Ministry of Health that we should have a health facility around this area? And if you have, let's have evidence of that before we justify this kind of postings. Thank you.
Honorable, thank you. Yes, I think that's part of the recommendation that we need to have a presence there. But in the interim, this is where we have. Now, we've withdrawn the staff. This is not come up as soon as the audit report came out. We've withdrawn the staff. But that is significantly affecting the outcome of care in that enclave. And that's what the Assembly has written. Our arrangement was to have a sit down and have an arrangement with them that in the interim, how do we support you? And as Chairman said, charge fees. Majority of the people in that community are having their health insurance cards. How do we ensure that they are not charging rates that is not exorbitant in lieu of what we are doing? So that's what we're trying to come here and get your concurrence that is this something that we can pursue in the medium term, whilst if a facility will be built there, is built there. But currently, withdrawing services there, but we have put people there providing public health services, antenatal care, family planning. That is part of our job. And we do that to all private facilities. These are free services that we offer across the country. Vaccination, family planning, antenatal care, those we are doing. But it's affecting them, and that's why we are here to make a case that in the medium term, we need to have some arrangement so that the service can be rendered, as the Assembly has also made a petition to my office to see how we can take it forward.
Director, when will that area be given a health facility? When? This is very important. Agenda 1.1 is there. You are building all other facilities everywhere, and you have data that suggests that these people are in dire need of a health facility. when should they expect a health facility in that area? Any plans?
Definitely, we will need, and it's part of the good advocacy that we're helping us make, so that some can be fast-tracked, so that something will be placed. I'm sure the ministry being here very soon will probably put something there to support the community.
So, Director General, go and have an arrangement with them.
Yes.
And if he agrees that it can be treated like a CHAC institution, it should be a special arrangement so that we can still post our nurses there, and then he must also charge the fees that the other CHAC institution and other Ghana Health Service facilities are charging, so that we know that expenses where we are making by payment of this salary for nurses is being benefited from the people who are paying lower rates. But if it's charging a private hospital rate, then it means that we are just spending money for nothing. Or he should go and employ his own nurses. There are a lot of nurses that he can employ, so that he render the services to the people. So that is what we should do. Let's move to the next one. No, you are done. I have ruled on the matter already. He was satisfied with the answer provided. Okay, go ahead.
Yes, DJ, I want to find out, correct me if I'm wrong, but the peak of the COVID was between 2019 and 2020. Is that right? Is that right?
2021 was even worse.
Yes. 2021 was even worse. Oh, it was worse than 2020. Okay, he's the DJ, so... but have the second part of the recommendation, the withdrawal and reposting, has that been effected? Are they still there?
No, they are not there. For some artists, we have withdrawn them, but it's affecting care, and that's why we wanted to get clarification to see how we can engage them.
I'm satisfied. Chairman.
Very satisfied.
Very satisfied.
He's satisfied.
Yes, Chairman, now we can proceed.
By God.
Okay. Paragraph 416 is about unremitted tier 2 contributions of casual staff. Has the money been remitted now? The amount is only 2,419.
It's been remitted, sir.
Auditors, can you confirm?
Honorable Chair, confirmed.
All right. Paragraph 418 on earned salary. That is St. Thomas Alan Rooney Memorial Hospital. I'm sure he's under charge. 2 staff, 54,009 Ghana cedis. Have you recovered the money from them?
Thank you, Honorable Chair. Our check indicates that we have duly transferred those staff to Ghana Health Service, and there were some internal processes that were done by the Ghana Health Service, and so the District Director of Health Services is here to respond with the evidence.
Okay. Why is the District Director? As the District Director, please come forward. That is Asankragwa.
Honorable Chair, from the response we got from them, there had been some internal transfer at the time the auditors visited the facility.
Yeah.
And therefore, the original facilities that they were posted to, they were not there when the auditors were in the facility for the audit.
Yeah.
But they are available at their new places, and all documents were available to support that. Thank you very much.
Auditors, have you done the reconciliation and verified that they actually earn the salary?
Honorable Chair, they have presented some documentations to us, but we are trying to reconcile with the district to be sure of whether they actually exist or not.
All right, so you need to do that.
Thank you, Honorable Chairman.
And get back to the committee.
Well noted.
The next one is paragraph 421. It's a National Ambulance Service, or SINO, unaccounted revenue. Your country. So 4,243. The recommendation is that the money should be recovered from Jonat Opari Akufo and pay same to the recovery account. Has the recovery been made?
Thank you very much, Honorable Chair. It has
please
actually...
Mention your name, please.
Oh, sorry. My name is Mohamed Mohamed, Head of Internal Audit, National Ambulance Service.
Okay.
I'm Seri Sowia Musa from Accounts.
Okay.
Yes. Honorable Chair, the amount has been duly recovered and paid as recommended by the Auditor General.
All right. Auditors, can you confirm?
Honorable Chair, confirmed.
Thank you very much.
All right. Paragraph 424. Ranking.
Center for Plant Medicine Research, Mampong Akwapem. And unserved bond terms. The unserved bond terms for three staff. Ishmael Ajay, Nana Yao, IC, and Sheila Boachi Akono. The total amount involved was 217,531 cedis, 71 pesos. What is the situation now?
Thank you, Honorable Chair, for the opportunity. Respectfully, that infraction does not...
Your name, please.
My name is Professor Alex Asase, the Executive Director of the Center. Honorable Chair, respectfully, that infraction does not relate to the Center. The staff that have been listed are not staff of the Center. And if you read the details, you realize that it relates to Ghana Health Service.
Yeah. So, Director, are you able to respond? Ghana Health Service, yes.
This is just coming to our notice, so we would follow up on it.
So we'll flag this one, but we want you to provide the response to us.
Honorable Chair will do that.
Okay. Auditors, you want some information, or you want to provide?
Yes, Honorable Chair, I agree it was wrongly captioned. I think we even informed Plant Medicine about it, but they still came. It actually relates to when you look at the institution column, we have St. Dominic Hospital, Equiapim South, and then Equiapim North. We've gotten responses from our district. I don't know whether we can speak to that, but we have responses from them.
Share the responses with us.
So for Ishmael Ajay, that is St. Dominic Hospital, the amount so far recovered is 30,000, leaving a balance of 4,600. And then for Akuapem South, it's still outstanding.
Then Akuapem North.
Akuapem North is also outstanding.
But Ghana Health Service, you should take interest in this and then work on it. Nana Yao, you see. And then Sheila Boachi Akuno. Both Akuapem South and North. But I'm surprised. Akuapem South, they put Ekropon there as a district. Akuapem North, too, they put Ekropon there as a district. Akuapem South should be a Buri. And Akuapem North, Ekropon. So we should make that correction.
Chairman, I also observed that if you look at the period of the bond under Akuapem North, for the same person, one is September 2015 to December 2019, and then April 2021 to September 20. How does that happen for the same person? Sheila Boachi Akuno. And that's one.
Benefits twice. You understand?
But if the person has been put on bond for a period and he didn't honor the bond or whatever, why do you grant him another one? But the Director General is here, so he can explain.
No, they said they are just getting to know.
Okay, thank you, Chairman.
Chairman, I disagree with the Director General that they are just getting to know of this matter. You released your statement of responses to issues raised in the Auditor General's report on public accounts of Ghana, MMDS, for the year ended 31st December 2022, related to your ministry. And you brought a copy to the committee. In that report, you actually went ahead to say that the information that captured and was labeled under the Institution for Center for Plant Medicine Research, Mampong Akuapem, was wrong. We all agree. So why didn't you go ahead to tackle the issues and give us the proper state of affairs? Why do you have to repeat that this was not in respect of Mampong and left it in your status, in your recommendation report? For then, when the matter comes before the committee, then you are saying that this is the first time you are hearing of it? And for the benefit of the other members of the committee, this is what you said. Paragraph 424 to 426. The finding of unserved bond totaling Ghana cedis 217,531 and 71 pesos under the name of Center for Plant Medicine Research was recorded in error. The details provided by the list were not staff of the center. Agreed. So you got to know of this. So my worry is that whilst coming here, give us the proper record of affairs. So when exactly are you going to correct this?
Honorable Chair, my attention has just been drawn to the fact that we have some updates on the issues. So, with your permission, if we can give those updates. For Akuapem South, we have one Nanayao AEC who was given steady leave with pay. Steady leave with pay to undergo a course in as a physician assistant. And after the program, he was released to the Ghana Prison Service by the Director General of the Ghana Health Service. So that officer is with the Ghana Prison Service, serving his bond there. Then for Ekwapim North, we have one Sheila Boache Akuno, a senior community health nurse, who also got 4 years steady leave with pay. She refused to return to the district for posting after her national service with St. Joseph Hospital, Koforidua. We've made all efforts to reach her, and we haven't been successful. We have since reported the matter to the Ghana police at Mampom, Ekwapim. So these are the updates on those two issues.
You're saying that the staff at St. Joseph Government Hospital in Koforidua?
She did her service there.
Okay. But you don't know where she is now?
Yeah, as at now, we don't know where she is.
Paragraph 427, Honorable Minister for Road and Highway.
Thank you, Mr. Chairman. Mr. Chairman, this deals with non-competitive procurement procedure and is from Mampong Ekwapim Center for Plant Medicine. Mr. Chairman, the PPA law of 2016 as amended, Act 914, clearly and unambiguously states how public procurement should be carried out by any procurement entity. It means that at least in undertaking any procurement exercise, quotations should be requested many sources as you practically want to do, but at least minimum you should be comparing 3 different quotations. The auditors found out that a number of purchases were made, at least 7 different purchases. In each of them, the procurement procedure was not followed. And this was between October 2020 and January 2022. In the first place, can it be explained to this committee why the procurement procedure, which is mandatory, was ignored?
Thank you, Honorable Chair, for the opportunity. I am not sure why it happened. I wasn't at the center at that time, but subsequently I have strengthened the procurement department, the audit unit and accounts to make sure that we comply fully with the provisions of the procurement law. I also make sure that we have monthly procurement meetings to make sure we address any such occurrences in the future. Thank you, Honorable Chair.
There are 2 issues that I want to deal with. I commend the new officer for the measures being put in place so that these infractions do not reoccur. But I want you to advert your mind to the fact that, as observed by the auditors, they could not ascertain the reasonableness of prices
the reasonableness of prices quoted in all the transactions. And to my understanding, it means that the prices were hacked. The items were overpriced. Do you agree to that?
Honorable Chair, subsequently, the district auditors have been at the center to look at the issue. And in fact, in their recent management letter, they have cleared us of any such infraction in the future. So that's what I can say. But I think they made that comment because there was no, not more than one invoice supporting that those payments.
I think it can be concluded that either the officer or the entity as a whole resulted to sole sourcing in the purchase of all the items. But if you consider the items involved, under the PPA Act and the law, the conditions for sole sourcing, none of these items could be applicable. Do you also agree to that?
Respectfully, Honorable Chairman, in this circumstance, that is what it is. But as I said, I was not the head of the entity at that time, and we have taken measures to make sure that this is never repeated. Thank you.
Honorable Chair, my last comment. I completely disagree with the recommendation by the auditors, if they are here. And with your leave, if you will permit me, I will read. The auditors recommend that the head of the center should strictly adhere to the provision of the Public Procurement Act. I wish the auditors had not even written this at all, because it does not make sense one bit. It does not. I mean, with this kind of infraction and the suggestion, even from the observation you yourself made, that you could not even ascertain the reasonableness of the prices quoted, then you are saying that you are merely advising that next time they should still adhere to the provisions of the Public Procurement Act. It's not, with the highest respect, it's not reasonable at all. Here, public money is involved, and we must not treat people with kids' glove. We must not treat people with kids' glove, to do whatever they like with public money. The auditors, in my respectful view, should treat such matters with greater seriousness. I thank you.
Well done. Thank you. All right. The auditors are asking you that make sure you adhere strictly to the Procurement Act. And I'm sure you are doing that. I've looked at the items that you procure. Some, I know the companies, and I know that they are recognized company and they cannot inflate the prices. For instance, if you say Seawayman Ghana Limited or Polytan Ghana Limited, but the law is a law. The law says go by this. Whether you do the right thing or not, once you didn't go according to the law, you'll be punished. Okay? But in this case, we will go by what the auditors have recommended. And we'll ask you to go. But make sure that you do the right thing from now onwards.
Honorable Chair, we are most grateful.
that'll be all for the center. Honorable members, we are going to break for 40 minutes. And I will come back at 2:45. Let's come back 2:45 to continue from where we left off. We have a lot to do, so when we come back, we should be mindful of the time. Thank you very much. The sitting is suspended for 40 minutes.